Let's call the meeting to order. City of Laredo, special city council meeting, council chambers, 1110 Houston Street, Laredo, Texas, January 30, 2025. It is 5:34 p.m. All stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moment of silence, and I would like to give Mayor Ramiro Garza from Edinburg my deepest sympathy for his announcement of having prostate cancer. He announced yesterday that he will not be running again, so our prayers to him. Thank you. You may be seated. All right. Mr. Secretary, roll call.
Honorable Mayor Dr. Victor D. Trevino,
Present.
Council Member District 1 Gilbert Gonzalez, Council Member District 2 Ricardo Rangel Jr., Council Member District 3 Melissa Cigarroa,
Here.
Council Member District 4 Ricardo Rick Garza,
I am here.
Council Member District 5 Ruben Gutierrez Jr.,
Present.
Council Member District 6 Dr. Tyler King, Mayor Pro Tem Vanessa Perez, Council Member District 8 Alisa Cigarroa.
Here.
Mayor, you have a quorum.
Thank you. Do we have any citizens' comments?
No citizen comments, Mayor.
All right, thank you. All right, before we begin, I want to let the public know that the bond referendum discussions today are based on recommendations from management and from our board referendum committees. This is not what has been approved. These are recommendations, which was the task given to the committees, which council appointed as representatives. I do want to thank the Bond Referendum Committee for all their hard work and dedication in this process. And I know that we all have been in contact with our representatives. So I want to thank my representatives, Chairman Hector Alanis, Rick Laurel, David Vasquez, and Jerry Maldonado. I also want to reiterate and share with my fellow council members that on the bond elections, we need to focus on the core functions of government. And even with these core functions, we need to prioritize our community's essential needs. So I would like to hear from management's position on each recommendation and vote on them separately. I mention this because just recently, I was on the verge of calling an emergency meeting when federal grants were frozen because it would cripple several of our city departments and effectively shut down certain essential services. One of those departments is our health department to the tune of $19 million and directly impacted 218 jobs. So the health department as a core service is a primary focus. This is not including our massive responsibility that we have with fixing our water infrastructure, which will include an initial critical step of $95 million for some of the lines that we know that are exposed to rupture and complete failure. And also the looming $800 million to overhaul the entire system. So please keep this in mind when approving funding today. So let's move on forward. Mr. Neb?
Sir, Mayor, City Council, I reiterate the thanks that the mayor has given. I will tell you that the Bond Referendum Committee took their charge very seriously, and they had a lot of really good conversations. We took that entire group of individuals and we broke them up into subgroups, and they walked through each one of the things. So I reiterate, I actually want to make sure that mayor, city council, staff, everybody that's been involved with this, Laredo has not done this very often. And so I think it's been a very good time for all of us to learn some other opportunities that we may have in order to help provide support for our services that we're providing. I also want to thank from after staff will be our bond counsel and our financial advisor. And we have representatives here as well too. So what we've tried to do for today was make sure that we had everybody in the room to assist you in how we walked through the information, how we brought it all to this point, and then to try to just answer your questions as we walk through everything. One of the things that I want to make sure that everybody is aware of, because when we started the whole conversation, we were looking at a May election. If we are to do the May election, we have until February 14th to have all of our, the ordinance essentially established as saying these are the questions we will put on the election. You have to call for the election by February 14th. We have tentatively scheduled a February 10th council meeting, which is on a Monday, so that so that we can do it earlier than the 14th, because if there's anything overlying, we need a little bit of time to make it, whatever the final adjustments are. So as you walk through today, as you walk through the information and everything, we want to make sure that you keep focused on we're running tight on time. And we have 15 days from tomorrow, counting tomorrow, to get all of this work done. For tonight, this is a continuation from Monday, because actually Monday helped us out a lot. The information that we provided you out from finance and budget is to help you. It's within this folder as well too. This is update based upon some of the conversations we had at the council, because we've actually included additional projects that we heard were important. We actually will have a couple projects that have been deemed as of yesterday that are not as important to put into this bond referendum. So all that information is going to be set on the table tonight. So I want to make sure you do that. Make sure you understand what we're hoping to get through. The only other things that I have to say, and then I'll kind of turn it back over to everybody to walk through all these pieces, is that we have the 15 days. What I'm hoping to do is that we spent a lot of time on Monday talking about police and fire, and we're going to come back to those, but I would like to make sure that we talk about the other two areas that we looked at. And so my recommendation is that once we get through with some of the conversation, when we start looking at the projects, if we can do health department, do the enrichment services, and then come back to public safety and public infrastructure as well too. I know we have a lot of individuals here that are very interested in this conversation, so I'm going to stop talking. And I'll share when it becomes necessary, but I think based upon the conversation at the council meeting, Mayor, City Council, I think we were going to allow the bond referendum committee to share some of their insights, what they learned throughout that course of that. And then when we get to the nature of looking at what the subcommittees have presented, I would just ask that we start with health, go to enrichment services, public safety, and public infrastructure.
All right, thank you.
All right, thank you.
Start with health.
And I believe your representative, who chaired the entire thing, might be able to say some things first. Would you have to? Yes. All right, thank you. And then I think if you want to hear from any of the other bond referendum committee members, they're here. So thank you, sir.
For the record, Hector Alanis. I chaired the main committee, but there was a lot of work that was done, through the, subcommittees who were chaired by Mr. Roque Vela, Chuy Olivares, David Cash Vasquez, and Tony Arce. So my hat's off to them for serving as chairs to the subcommittees. But it was quite a bit of a learning experience. I think everybody, put all their efforts. We worked really hard. We took it very seriously. There are some things that we kind of understood, and some things that we kind of learned from having some information, some talks with the consultants, and of course the city manager and assistant city managers. We all know that the bonds were at, we were given a task of, using about $800 million. And I think all of us understand that, that's a lot of money. And so we have a task of serving as an advisory committee to City Council. And of course, City Council will take our considerations and recommendations, review them, and then of course you're gonna tweak them, and of course then it'll finally go to the voters. We did not have a last opportunity to meet once again as we had planned to prioritize the projects, but I think, some of the department heads are gonna be talking about that. And I'm pretty sure that when you speak with them, they'll let you know which projects, are more important to them. We all know that public safety is at the top of the list, but there was other projects that were discussed in the health and wellness, subcommittee, the enhancement services, and also public infrastructure. So again, thank you for giving us all the opportunity to serve. And if you've got any questions, I'm here to answer, or any of our chairs would be able to assist with that.
Any questions? All right,
Thank you.
thank you very much.
Good evening, Honorable Mayor and Council. Jesus Esparza with the Budget Department. We're going to be looking at the file that has all the projects, and as was mentioned, we will start with the health and wellness. The attachment of the file that we're going to be working in was presented to in the folder right now, so that's a hard copy of the file that we have in here. The file that we have does have additional information that we're going to be working with, but that has all the projects listed in there. No.
Councilman, you need something? One book? Oh, that's a fire.
Mayor, may I be directed?
Yes, go ahead.
Is it the same booklet that you gave us last time, or is it a new one?
It's a different one.
It's a different one?
Yeah.
Do you have a hard copy?
Yeah, the first,
Can we go?
this slide that we have here,
So we're going with the same one that we had the last time that, oh, this one? That's the old,
the packet that we had on the previous meeting
all right, cool.
was missing this column here on the screens, which it says council. The other three columns before that to the left were the same amount, the subcommittee, the main committee amounts, and the city administration amount. This is the adjustments that were made yesterday based on our meeting on Monday. If you notice, the fire on the top has 85.3.
Sorry, I don't mean to interrupt.
Yes, before we proceed,
Question.
just just acknowledge that Councilman Rangel is here, and Councilwoman Vanessa Perez is here. Thank you.
So, and I'm gonna go, this is just a summary, and then we'll go into the health tab and all the different projects that the health department has. There was an adjustment there, and that amount was reduced to 85.3 based on the conversation with Chief Hurd. The police is the same amount that we had, 176, as well as health and community development. Public work paving project, the same. The other project, the Parks and Rec, was the one that was 40 million. The new amount is 80,700,000. That includes now a couple of projects that we have in the tab itself, and we'll go over them. So from here, we're gonna jump into the health department detail. So this is the health department, and on the top, we have it by years, 27, 28, 29. Those are the years that were submitted by the department, Dr. Richard Chamberlain. We have in there construction, design and survey, equipment, furnishing, and contingency. This is one main project, the different amounts that were considered, and it's a $70 million project for the expansion of the health department. If you want Dr. Chamberlain, he can come in and
Yes, yes, Dr. Chamberlain,
he
please.
can go over the amounts. Just briefly, we have the 27, 28, 29, there's nothing in there. So his main project is only on the fiscal year 27. Total project is 70 million. So I'll let him go over this.
Good evening, or it's still a little bit of afternoon. Good evening, good afternoon, Mayor, members of the council, Dr. Richard Chamberlain, your Public Health Director. And if you would allow me, I can give you a little bit more context about our proposal for the enhancement, renovation, and expansion of our Public Health Department. And I'm just going to share a little bit more with you all. And I, first off, also want to start off by saying thank you very much to the committee members, to all the committee members who are present here today, and to those that served on the Health and Wellness Subcommittee. We appreciate your time and the service to invest into this proposal. And as you all very much know, Laredo Public Health does so much more than just vaccines and birth and death certificates. During this situation that we are experiencing with this most recent freeze of federal funds, there are, just in the federal funds and state fund side, we have 41 different programs and services. So that is an array, a very dynamic health department that is ensuring that we are serving, protecting, preventing, and transforming the lives of the residents of Laredo and beyond. Some of those programs go beyond the city of Laredo and Webb County as well. And so with that, we are wanting to make sure a healthy population means stronger families, productive workforce, thriving economy, and investing in our growth ensures healthier lives, stronger communities, and a brighter future for all. As you all may know as well, the public health challenges that we experience here in Laredo are high chronic disease burden, mental health care and behavioral health needs, substance use and addiction treatment gaps, health professional shortage and medically underserved designations, a high under and uninsured population, and the vast array of social determinants of health that our community experiences due to us being a resource desert. Here's some data that you can see here on these maps. Specifically, you're looking at diabetes, at high blood pressure, at high cholesterol, at obesity. And as you can see, they are very dark shaded, the vast majority of these census tracts. This is demonstrating that we are very high in all these levels when compared to the state, when compared to the national average regarding our prevalence in these specific chronic diseases. Some of our census tracts on the diabetes side are as high as 30% of persons over the age of 18 that have diabetes. Our diabetes prevalence in our most recent community health needs assessment was 15.7. I still feel that's a little low because that's diagnosed, and we know that there's a lot of undiagnosed individuals as well. But that translates to about 40,000 plus persons in our community that are diabetic. With that, we are sharing here a little bit more information about stroke, about depression, about COPD, and about heart disease. And at the root cause, public health can make sure that these prevalences go down. I want to share a little bit about the cost of inaction. The combined economic burden of diabetes, hypertension, and obesity in Laredo is conservatively estimated at between $854 million to $1.2 billion annually. So that is for the indirect and direct costs that persons who are diagnosed with diabetes, with obesity, with hypertension pay out because of their health status. So this is alarming that this number exists because of poor health status or low health literacy, and that's where public health can also come in and help out. And so a little bit of background in the need. Laredo Public Health is requesting the $70 million in bond funding to expand and modernize its infrastructure. Opened in 1970, and the health office was created by this council in 90 years ago in 1935. So we're 90 years strong as a legacy public health department pillar in the community, and we want to continue to grow and transform with our population. The investment will allow us to expand to 120,000 square feet. Currently, we're about 80,000. This will add a 15,000 square foot clinical research space and a third floor, which is an additional 25,000 feet. A structural assessment of the Laredo Public Health Department is funded for FY 2025, as this was in our vision for the community and has already commenced. Since January of 2024, Laredo Public Health has submitted 18 funding applications totaling to $48 million, securing 7 of those awards, and we're pending 2 totaling to over $10 million. And as of this moment, we are on our journey to expand research on the border, contribute to the literature, make sure that border health, Hispanic health, Mexican American health is something that has a bigger foundation in the literature, where right now we do have ongoing research with UT Health, Sam Houston University, the University of Florida, and the University of South Carolina. Key needs addressed with this potential investment into public health. So we are wanting to make a difference in that prevalence. So a modest reduction of just 1 to 2% in diabetes cases could eliminate between 400 and 800 cases annually, saving the community between 7 million and 14 million per year in healthcare and productivity costs. This proactive investment would allow the $70 million bond to pay for itself within 4 to 9 years, demonstrating both economic and public health benefits. The proactive solutions for long-term gains will allow us to expand and increase space for staff. Currently, we have many staff who are crammed into tight spaces because we continue to grow with the number of awards that we respond to by the conversations that we have with the members of our community. We don't just listen, we truly understand, and we apply to those awards, we bring them in, we secure them, and we grow, but we don't have the space to do that. And we're just building for a healthier future. This is our projected timeline. We do have for FY26, which would be the design and survey, for the 15,000 square foot clinical research center, it'd be 3.1 million. For the third floor and remodel, it'd be a 25,000 square foot at 4.8 million, followed by the construction of the clinical research center at 15,000 square foot in today's market at $750 a square foot for $11.2 million. If we were to project that at into the 27-28 market, there is a projection at $13.2 million with a project contingency of $1.2 million. In FY28, we do have the remodel of the first and the second floor, the construction of the third floor. The remodel is at $10 million of the 25,000 square feet. The construction of the third floor, an additional 25,000 square feet at $21 million. And at the market for 2027-2028, it would be at $26 million for a total cost of $68,913,000. Here's a budget breakdown, as you can see, in comparison from today's market to build and the market in 2027-2028. The vast majority of this is for construction, followed by design and survey, remodeling, the furniture, equipment, and the M&O costs. The furniture, the equipment that you can see that we propose to have included into this expansion would include a mammogram machine. As we know, it's very difficult for women in our community to access mammograms quickly, as there are only a certain amount of access points in Laredo for this service. Investing into a new x-ray machine. Recently, we're hearing about the outbreak of active TB in Kansas and the numerous numbers of the latent TB cases there in their vicinity. And we do have cases on an annual basis here in Laredo, and our equipment is already dated for our TB response, and this would be an investment into that. Autoclave for the laboratory, an infectious disease analysis machine for a laboratory, and generators to support those if power were to go out, and then of course going into our M&O costs. Our M&O costs, as you can see here, do include salary and fringes for the additional staff, materials and supplies, contractual, capital outlay, and debt services, which kick in FY 28, 29, and 30. This is the proposal, as you can see here from this graphic. Of course, those arrows are pointing up, meaning we would build up, but they're also pointing in the north direction, just to give you some context. So you do have you have your Cedar entrance and your Maryland entrance on the graphic, but we would build up on the health department, and we would add in that research building on the south side of the campus, which was formerly a Webb County Head Start. That property has been returned back to the city of Laredo. The Head Start modular building has been removed as well, and it is ready for construction. And so on December 9th, the subcommittee motioned and approved to allocate $70 million from the proposed bond referendum funds to strengthen public health, which we really appreciate. And I will stand by for your questions.
All right, thank you. Any
Mayor, I have a
questions?
question.
Go ahead.
Dr. Chamberlain, thank you. I understand that you've presented some statistics in terms of needs of the community, but do you have statistics in terms of actual number of people taking advantage of the programs that we currently offer? Are we maxed out at what we offer? Like, how many people are taking advantage? Do you have estimates on how many people are projected to take advantage of the mammogram machine? You know, what's the usage gonna be? Is there gonna be insurance involved? You know,
I
do
can
you
start
have any of
answering those
those
questions
kinds of
if you'd
data?
like me to answer those questions for you. Yes, ma'am. So to start off on the insurance side, we want everybody to know public health is for everyone. Public health isn't just for our under and uninsured populations. We have insurance, we accept insurance, and we accept self-pay. So we want the community to know to visit Laredo Public Health, because we can provide that support to the best of our current resource abilities as of
Mayor,
this
if I
moment.
may?
Yes, go ahead.
What's the cost for the person who would have to pay out of pocket to be able to utilize this machine if we did buy it?
Don't have that granular data, but we can definitely get that to you. Of course, self-pay would be a little bit higher than insured, but we also want to be able to run a program that somewhat plays Robin Hood to take care of our under and uninsured populations as well. So that is in the discussion if this were to go through.
Right.
This would allow us, of course, some additional time to be able to get that granular data for you to be able to provide that. But we do know that there is upwards of 2 to 3 months wait time for mammograms in Laredo, which you would help carve into. I know Gateway just got their machine as well, so they're working to bring that time interval down. And if we were allowed to, we would be able to get back into this. And typically these machines last anywhere from 15 to 20 years.
So do you have any data with you on, like, the other questions that I asked as far as?
So we have more than 30,000 encounters on an annual basis at Laredo Public Health, and we are more than willing to expand on that, but we are also bound by the number of staff and availability and space that we currently are maxed out at the 6,000 families that we serve right now in the clinical setting.
Mayor, if I may?
Yes, go ahead.
I think it would be helpful for us to see, you know, like, for us to see the need in those kinds of numbers as well. Just because, you know, we're facing a big bond here, right? And we're gonna have to, I mean, and I'm anticipating that we're gonna have to cut some things. I just wanna make sure that we have the supporting data for.
We absolutely will get that to you, and as we do know, we are medically underserved. We
Right.
are a health professional shortage area. People have to leave Laredo to get basic services as well, because our community is so heavily taxed. Our ratio for family medicine is 1 to 3,251. So we want to be able to be part of that solution too at Public Health. So is the need here? Absolutely, the need is here in Laredo for this type of expansion.
Thank you.
Yes, go
I
ahead.
mean, yes, and along the same lines, you know, because there is as you're familiar with, there's a breast cancer grant program that I believe the city and Gateway Community Health Center have both gone for in the past. And to the best of my knowledge, Gateway Community Health Center currently has that grant program, which is for the uninsured. And so, you know, thinking about how that would, you know, impact the uninsured's access to the mammograms as was stated. And then, yes, we are public health, and we do, I understand the idea of you all accepting insurance to be able to bring in some revenue, because that's great for the city as well. That, I did have that concern as well. And my second question was related to one of your slides where it mentioned a decrease of 1 to 2% diabetes rate would save X amount of dollars, and I think you stated pay for itself in 4 to 9 years, but that kind of implies that this building, or this remodeling, this expansion would lead to a reduction of diabetes by 1 to 2%, which
Correct.
I think, I mean, unless I'm wrong, I don't know, I mean,
I can explain that a little
yeah,
bit
how
more
can
if
we
you'd allow
prove that
me.
this would lead to that, yeah?
Yes, so with our current operation, we do have one chronic disease prevention supervisor and one health educator. And those individuals touch anywhere between 150 to 200 lives on an annual basis. And we've seen that 95% of those have a reduction in their A1Cs. And so we would also want to see the reversal of diabetes when catching more people. So with the expansion of this building and the additional staff members that we can add through the M&O process, we can have a team of 5, 6, 7 diabetes empowerment educators that are going around doing the good work of this chronic disease prevention at this facility, beyond the facility, touching between 400 to 800 additional lives to make that reduction as we are seeking and proposing here.
Mayor, may I?
Yes, go ahead.
And to that point, the diabetes being so prevalent in our community, we know that UT Health Science Center, or that campus, I guess it's UT Education and Research Center now, that they're very involved in looking for research opportunities. And perhaps once this administration decides to widen its focus, we can really look at seeing our Hispanic population and what can be done because diabetes is so prevalent. I was just speaking with a physician who was talking about how diabetes leads to so many comorbidities that are just so dramatic and expensive in our medical system, whether that's high blood pressure and resulting heart attacks and other comorbidities related to diabetes, the loss of nerve sensation and how it makes getting older riskier and just more painful for our elderly population. And if you can avoid diabetes, then you can preserve that quality of life as they age. And we're not talking about people who are old. We're talking about perhaps my generation and older, getting into your 60s, your 70s, when your quality of life still should be so high. And yet if you suffer from diabetes, like so much of our population does, you are at the mercy of whatever healthcare you can find. And so many people do not seek healthcare because perhaps it's a cultural thing, that diminished quality of life. If the City of Laredo Public Health can do something to improve that, I think that's a tremendous benefit that we give to our citizens. And also the savings that you get from preventing those people from going into a very expensive medical system would benefit the city. So I'm glad to see that that's a focus.
Do you have a question for him?
I'm supporting his point that looking at diabetes and that focus is something I think that will bring great benefit to our city, and hoping that in the future we can look for opportunities to work with the UT Education and Research Center.
Yes, ma'am.
Go ahead.
Dr. Chamberlain, thank you so much for the presentation. I know there's many details we could break down, so many, and we can be here all evening and that's fine because they're important. But the truth is, this building was built when Laredo was half of the population that is right now. So it's very important. That's the idea because of the space and due to the growth. So I want to thank the committee for bringing this to us and your presentation. At the end, it's going to be up to my colleagues' opinions whether this citywide project and the taxpayers the taxpayers citywide would utilize for 100 more years would be good to go to the referendum. Thank you.
Yes, sir.
Yes, go ahead.
Dr. Chamberlain, the building that you said that was returned to us, is it functional as it is right now?
The building was removed from the property as it was a property of Webb County.
But you said it's given back to us, or
No,
not in the
Webb
diagram?
County owned the building, they removed it from the property. The property belongs to the city of Laredo.
Oh, but the property's like vacant right now?
Yes, ma'am.
Okay, so there's enough space to construct something there?
Yes, ma'am.
Do you have a price just to construct something on that piece of property alone?
Yes, ma'am.
Do you have it broken down separately?
It's right here on this slide, as you can take a look. So you would see that the clinical research center design would be 3.1 million, and the clinical research center, depending on, of course, not today's market, because it wouldn't happen today, so it would be 13.2 million for the actual construction.
13.2 million to construct on the piece of property right now that's vacant.
Plus the design, which is 3.1. The survey and design of the land and all the engineering stuff, so totaling to about 16.5.
And what would you be able to fit inside of there? Like,
So
what
it
part
would
of
be our clinical services expansion and allowing for the research component to come in as we are building that right
this?
now.
Would the mammogram machine go in there or
Yes,
in the main
ma'am, the
building?
mammogram machine would go there.
The mammogram machine and the other machine you're asking for as well?
The tuberculosis one would go into the TB clinic that we have existing right now.
Can I have, Mayor, if I can ask Mr. Esparza
Yes.
a question?
Yes, go ahead.
Thank you, Mr. Esparza.
Yes.
What is the impact to the taxpayer for the 70 million as proposed? If, let's just say this is all we bonded out for, does that look like? Do you have it broken down to that kind of level?
Yeah, it's one of the slides that I have, if I may go back to it. So at we're looking at 1 cent will generate about $2.4 million in revenues, and that would finance about $40 million.
And that would cost the taxpayer, the average taxpayer with a $200,000 home, $1.67 a month, more or less?
Correct.
So this right here would get us about, like, you're looking at $3-4 a month, more or less, per economic impact on the average taxpayer, more or less?
What's the total?
70 million.
No, the 70?
She's asking for this for the 70 million.
Yeah, just if it was at the 70 million, but I can see that even if we were to approve the construction of the new building on the piece of property, and we could still move forward with some of the requests, even if we couldn't get the whole 70. And I can see that, more or less, like, so we can kind of see what the impact would look like.
2 cents. Just under 2 cents.
2 cents, more or less.
Thank you for that approach, council member. I would also like to kindly request for the inclusion of a remodel, as our current building does not have fire suppression. It is not ADA compliant, and so that would be part of the refresh, not the third floor building, because that is a bigger cost to have that, but for a potential remodel.
Do you have that broken down here as well
Yes, ma'am.
individually? Can we get a hard copy, Mr. Nab, of his presentation? Yes, yes. Thank you, Mayor.
All right.
I also did send you all one just so you could have it.
Mayor, the way we have the file design is as we plug in the numbers there, we have a separate page that will give us the amount of pennies needed for this. So we're trying to update some of these numbers so I can give you an actual number, an actual estimate of what that is.
Do you have input from the Health Committee Chairman? We can have some?
So on the screen,
Mayor,
I
wanted, Dr. Chamberlain, or do you have committee members, or any committee member that was part of this? So just to give us their insight or their opinion, why they wanted, they approved this budget?
I didn't know I was going to speak tonight, but good evening,
Thank you, Mr.
council,
Cash.
mayor, city management. David Cash Vasquez, for the record. I am the chair for the Health and Wellness Subcommittee. You've heard about all the work that was done to bring forward this proposal. It was actually a lot heavier, and so we trimmed it down. We actually started with a pediatric hospital in mind. And we even brought in professionals from the private sector to speak about the need for such a building. What I will say is that there is opportunity because of our medically underserved community. The stats that you see or that were shown to you should be reason enough to just push forward, right? We're beating everybody in diabetes. If you don't know somebody in Laredo that doesn't have diabetes, I'd be shocked. Somebody that has hypertension, somebody that has depression, the numbers are alarming. There is a serious health issue along the border. You've got FAR, Brownsville, and Laredo leading the country in diabetes. So we need to address this issue. With poor health comes poor communities. Economically, it is it's a stinger. When you have poor health, it equates to poor economic status. You can see it all across the country. The data, women lie, numbers don't. And the data is telling us a story. And so when you start to get into the clinical research part, we need to find out what's happening. Culturally, there's an acceptance of our food and our drink. We're proud of it. But after a while, too much of a good thing can equal a bad thing. And so to say that we didn't feel like this particular project with public health was important, I thought this is probably one of the things that really stood out the most. If you haven't been to the health department in recent years, try walking in there. And or try, ADA access is another issue at the health department. So public health is really, and I work for Gateway Community Health Center. We serve 34,000 patients across 3 counties. We deal in 7,000 diabetic patients on a regular basis. We deal in 120,000 visits per year. We almost quadruple the rate of what public health is seeing. We're inundated. They're inundated. There is an issue. And it doesn't matter whether you have health insurance or you don't have health insurance. You can't find a specialist, or if you do find a specialist, good luck, because it's going to take you a year to get in to see the gastroenterologist. It's going to take you, and when we talk about a specialists, those are all the nephrologists, oncologists. That's why all this money that Dr. Chamberlain was talking about is getting pumped out. It's an economic driver to other communities. So instead of that money staying here in Laredo, it's being pumped out to San Antonio, the Valley, and points beyond. And so this is a step forward in terms of us being able to, 1, tell our story with clinical research, 2, advancing the ability in services. And while we also deal in radiology, and so does Laredo Medical Center and Doctors Hospital in terms of mammography, x-ray, ultrasound, we also offer that too, but I guarantee you it will not be enough. The demand will be there. And so I'm not sure if anybody else has any additional questions, but that was what came away from this group and this committee.
One of the things I did want to say or ask, after working at the health department for 36 years, I've seen how the clinics impacted primary health care. And we might not have all the specialists here in town, but the creation of a need for specialists is related to the lack of primary care and all the complications that follow. So we would need much more specialists if we didn't have primary care. The health department has provided clinics that give good primary care. I've worked in them for 36 years. Clinics that keep the population healthy. So that is one point of view that I did want to put out here, because That is, I think, important to me.
And I'll agree with that, Mayor. I think primary care is preventative care. Preventative care prevents $5,000 bills at the emergency room. So pay $50 now, don't pay $5,000 when it's too late. And so in terms of the economics, we can see what impact primary care, public health would have on this community.
Go ahead, Councilman.
Just a couple of comments and a question. I know it's been put out there, obviously, that we are really up there when it comes to diabetes, right? That City of Laredo is one of the highest population with diabetes. We've known that for a while now. With these monies, should they get approved for the $70 million, what are we talking about when it comes to prevention? Because obviously that's the point where we want to get to. We don't want to just continue having people going to clinics or doctor's offices and getting prescribed metformin, Jardiance, whatever else might be, right? Starting off at a low dose, getting to the highest, and then there's no more help for you. Metformin can't do much for you then. So my question is, should we invest these monies there? What are we going to be doing about prevention? Actually preventing this from happening, from our children getting diabetes and then growing to becoming adults, becoming diabetic. That's what I'd like the answer to.
I can share with you recently that I also became certified in lifestyle medicine. We have another professional, an internationally board certified physician too, that is at our department with lifestyle medicine certifications. We do have a physician here in the community who we would be collaborating with on the lifestyle medicine journey for the community. And so lifestyle medicine focuses on 6 specific pillars. And those 6 specific pillars, the vast majority of us do give more emphasis to nutrition and physical activity. And those are definitely something that we need to be very focused on, that the health department would continue to elevate and expand on. But then we would also go into the journey on the prevention, attacking chronic disease at root cause, which include those 2, but also includes sleep, stress management, or restorative sleep, stress management, healthy social connections, and eliminating risky substances like high concentrations of alcohol, tobacco, and of course if there is any other illicit substances. So we would work on that path by implementing a program of lifestyle medicine founded through Laredo Public Health, which I can tell you that the American College of Lifestyle Medicine has already reached out to me because they are seeing that a public health department is taking this approach by injecting it into population health and not just being in the clinical setting.
Do we have anything in place now as far as the school districts are concerned, UID and LISD in particular? Because from what I see what they're feeding our children in the morning, from syrup, pancakes, Pop-Tarts, cereal, they're all sugars, obviously, and they're going that way. And that's just something that they continue doing from pre-K all the way through 12th grade. Do you have a program now that addresses this in particular?
We would begin to infuse lifestyle medicine into all the different organizations. I know that LISD, I don't know if it's still ongoing, but they did have the implementation of their salad bars, and it's very important for us to make sure that we offer those choices. So that nutritional part with our registered dietitians at the health department would be conversations that we can have to make sure that we are able to implement those lifestyle changes early on in life to prevent these chronic diseases.
Thank you.
Yes, sir.
Yes, go ahead.
Dr. Chamberlain, I took a tour of the facility the last time. By the way, I'm Rick, I'm the new guy. I told you that that was my neighborhood. I grew up there. When that building was built, we thought it was the Taj Mahal because nothing like that had ever been built anywhere around our neighborhood. And in the 70s, that used to be our playground. So, a little bit, I think the most important thing to realize tonight for everybody, and by the way, thank you to the committees. You put some heavy hitters here together to discuss and interact with each other to try and get the best solutions for this bond election. And I thank you all for coming over here because I know that, knowing some of them personally, they took this job very seriously, and that is something that I do too. Having said that, throughout the night, you're going to hear a theme from me that I will play a little bit of devil's advocate. We're going to do comparative analysis, and then we're going to try and figure out how do we get all these ideas together, formulated into one, primary goal, to sell it to the public so that they can, go through with this. And although all of these ideas that you just said, by the way, a side note, I made very clear when I was at LISD for 12 years, I was an advocate. There is nothing that we touch today that doesn't have fructose in it. The fructose lobby is one of the biggest lobbyists in the United States. So anything you touch has fructose in it. And so diabetes is going to be prevalent with everything that we do. So, but we have dietitians at LISD that made sure that our breakfast met the standards that the government had set forward so that we can meet the standard of minimal amount of fructose. So having said that, we are coming back to the same idea. I do believe, I took a tour of the building. The building was, as old as it is staunch. It is institutional. It is clean. It represents what I think welfare is a dirty word. It represents a medical facility of the toughest form because it is built for the masses. So it's a very tough building. I do believe you're right. I mean, one of the ADA compliance, right? I've noticed it right away. It is way underneath ADA compliant in there. So that's neither here nor there. But the comparative analysis that I'm going to make is that I'm also very aware, because I visited most of the facilities for the Gateway Community Clinic. They do an outstanding job. So here we are, 2 facilities in Laredo that fit the needs of the underserved community, people with no insurance, the underprivileged, and yet we are still in dire need of more. So here comes my devil's advocate. I know that you guys are doing your best through no fault of your own, the way this country is being run, and the way the whole system works, makes the system the way it is. Did the committee consider the interjections and bringing in the county to do part of its job on any of this?
The committee did not discuss bringing in the county into the public health venture. The county currently does have a public health office. It is not a public health department recognized by the state of Texas or the Texas Department of State Health Services. But that conversation could be entertained, absolutely, to be able to do more.
And the reason that I'm asking is because there's a ton of money out there that they may be accessible to. And this is the devil's advocate thing, that there's a lot of money that's out there that might be available for the county that we might not be privy to, that we might be able to offset some of the cost in serving the community here in Laredo for
And
them.
I can answer that. There is a lot of money that is out there available, especially through HRSA-funded opportunities, but it is strictly for rural areas to be able to build, enhance, expand, renovate. It wouldn't be for urban areas.
Do we consider everything under the ETJ of Laredo, Texas to be urban?
Our current location for HHS would be an urban area.
Okay, that's good. That answers my question right there. Then the second part of this is because we're going to go into other departments and how to do this. One of the other things that I know for a fact on how to pass these elections is that the city, and just like every member of the committee, asked you these questions that were very detailed and very focused. The underlying reason that I'm asking this is because the citizenry, the electorate out there, is very smart. They can see whether they'll approve something like this for the sake of public health, that they understand. Laredo is one of the unique places that does that. My question is to you, is that given the opportunity that we move forward with this, are you prepared to go all in on passing this bond election?
Absolutely. I think because of the most recent emergency response via the pandemic that we experienced here in Laredo, it put that public health into a spotlight here in our community. It did not have that spotlight before. Public health was always doing good stuff, but it wasn't in the spotlight. Now public health has been put into the spotlight. The public is consistently looking to public health to help them with their needs and ultimately to help elevate and transform their lives. So riding on the coattails still of that unfortunate situation of SARS-CoV-2, the pandemic, I believe that the community would be in support of funding that would enhance, renovate, expand, the public health department.
If in fact it does, I would just suggest one thing that I just see that just jumps out at me on your proposal. Equipment is one thing, furnishing is another. It seems like it's a high figure for furnishing, but you have to explain that because I think it jumps out at you on this proposal. And again, I'm the new guy. I have not been privy to a lot of this information. You guys started in October, so I'm trying to catch up. But just on the optics of it, the renovation part and all that kind of stuff sticks out very nice. I mean, it's right along those lines. But when you put furnishing in there, I think the public sees that and it just fogs up everything else. They forget about why is it so much in furniture? How many chairs are they gonna put in there? That type of thing. So I don't know, we can reevaluate the wording behind furnishing or go into a little bit more detail. Why is it so much? And so the more detail that we give the public as to why we're doing these type of things, I think the people will understand. There are good people out there that probably want to help this, but they're going to want to do two things: that they're not being taken advantage of, number one, and that this city shows the stability to pay back these bonds. That there's not internal dysfunction enough that it'll veer away from this wonderful story that you're telling us, that it won't do anything because anything else that we're not doing here at the city is going to offset that. So you understand what I'm saying? The focus will not be on you. It'll be on why we're not going to do it. And so those are the type of things that we need to, I think, talk about very candidly, because I know that the need is there. I mean, I went and did the tour with you, and it's such, you guys are doing such a wonderful job, such an incredible job, that I would hate to see it not happen simply because we just didn't communicate our product the right way.
Absolutely. We'll definitely take that deeper dive.
Who is first? Go ahead.
Just to expound on Councilman Garza's comment, I was going to ask about the furniture specifically in terms of how much of that furniture is medically specific, right? And then how much of it is just general? And I guess having a more detailed analysis in terms, and then at the same time, the M&O costs. I have a question for management. Do we have a plan to fund this? Are we gonna go out for more grants? Is this gonna come out of the general fund? What are we gonna, cause we don't wanna just, I understand the needs there. I understand that it's gonna benefit the public and everything. But I am struggling with, because like you stated also, people are hesitant to seek, help and seek medical care. So, just because we add more programs and more facilities doesn't necessarily mean that more people will come. I could be wrong about that. I hope I'm wrong about that. But I just want to make sure that we can afford to fund the M&O costs as well. And if there's a plan for that, like we're going to go out for this grant, or we're going to do this, or we're going to do that. I mean, we just had a scare that some of the grants might have been cut, and we were all kind of scrambling on, how we were going to deal with that. So just want to make sure that we are taking all that into consideration.
Mayor Jesus Esparza with the Budget Department. As the discussions went through the different committees and with Dr. Chamberlain, part of the issue that he has right now, like you mentioned, is that he doesn't have any more rooms. So they've been aggressively applying to grants. But as he gets additional grants that come in, we have a shortage of space to put him in there. So it's going to be a combination of grants that are coming in, and we are going to have an impact on the general fund. General fund funds the what we call the grant, the operations, the 2900s. So we have been incrementing that amount that general fund goes to health benefits. So it'd be a combination, but primarily I think it's mostly grants that are available out there that they're seeking, that we don't have the space right now to put the staff.
Mayor?
Yes, go ahead. Oh, sorry, you were next. Go ahead.
Okay, thank you. Dr. Chamberlain, yeah. I think I met you 4 years ago when I was rotating through the health department as a resident at the time, and got to meet you and Dr. Saralan. I got to spend a month there and see the need that you have. It's clear that there's great people in there who can do great things, and you see the lines of people waiting to get vaccinated. You see there's only a few primary care clinics. I'm very supportive of that. I think, the idea is talking about this entire package as a whole. This will be the first one of many. I know Mayor had mentioned possibly deciding them as we go, but I hope at the end we can all also see what that final number is and have a final review before, moving forward. And just to be clear, this is the type of project that if for some reason the voters did vote it down, we would be able to adapt to that during the 3 years where we can't issue COs for something like this. I want to remind everybody that even if the voters do vote any of these items down, if we do move forward in May, we are allowed to go back to them again in November or whenever we want to, the next May, the next November, whenever we like to ask them again for the same or less of these items. We're not allowed to issue COs for 3 years without their permission, but we can go ask their permission again whenever we'd like. I just want to remind everybody that factoid. And I think if you look at other cities, they rarely are having to go out for bonds for public health things, because typically in most major cities, it's the county health department that's in charge of these things. We're talking about McAllen, we always compare ourselves. That's Hidalgo County Health Department, Cameron County Health Department, Brownsville, Bexar County Health Department in San Antonio, Tarrant County Health Department in Fort Worth, Travis County Health Department in Austin. So El Paso County Health Department, we are very unique in the fact that we have a City of Laredo Health Department. And that puts an extra things of burden on the city that we are having to take control. I appreciate Councilmember Garza bringing that up. That's something unique to Laredo. And we see the numbers and how severe our situation is, and it's so much of that burden is on the city of Laredo, and that's tough. Nonetheless, we are in that situation. Perhaps down the road that can shift, but that's not for us to necessarily decide alone, because we have a partner who we have to talk to more often about that. But I do support moving forward. And because I want to also say, anything that we put forward tonight to the voters, at the end of the day, we're not ultimately the ones deciding whether or not it gets funded, right? It's the voters who will be the ones with the final say. And also the reminder that all of this money will not be dished out all at the same time. We'll have 5 to 7 years to plan our budgets for the M&O costs that come from this. So I'm just that's my comments. Ultimately, I anticipate I'll be supporting moving forward with this for the reasons I mentioned. So.
Yes, go ahead.
There was a suggestion that perhaps the standalone building could be of service and the third floor addition could wait. But as I understand it, the standalone building will have a completely different function and really extend the ability to look at this prevalence of diabetes and other diseases. We know that we're also the #1 place for Alzheimer's, unfortunately, and we believe there's a connection to our Hispanic population, and those things will continue to develop. And that will occur in the extra clinical services in that extra facility. So the third floor, can you explain a little bit about what you envision will be happening in that third floor?
The third floor would be the additional space, as we do have 1, 2, 3 different programs outside of our campus already. We absolutely believe in decentralization of services, but we also believe that we should have those services at our core facility. So we do have programs that are leasing property right now that we would bring back to the Laredo Public Health Department to be part of that third floor, and then the additional continuous work that we do for looking for state, federal, and private awards, and them have the ability to have a space to occupy as they are carrying out their scope of work. Yes, ma'am.
Just one last thing. We did mention that you do have preliminary work or preliminary documentation that the third floor does have the stability, the structural does have the stability to get the third floor going? Or the second floor does have the stability to hold the third floor?
The architectural plans that were developed in the 1960s do have the third floor. It was not constructed, but we do have a staircase in in the staircase alley that leads to nowhere because it was supposed to have a third floor. But it's there, but we're doing that structural assessment right now. It's out for bids, so that way we can be told that we can do the third floor.
Like including a chase for elevator?
Yes.
Okay, all right, thank you.
All right. All right, any other comments? Thank you.
Thank you for your time.
Thank you.
Mary, just to get back to the question, the approximate transfer that we have right now from general fund to health is about $9 million. The MNO that potentially we're looking at for the full 70 million as we have it in the plans can be about approximately 7 million in MNO costs that would be tying as the expansion continues. So, like I mentioned, part of it is gonna tie into how much grants we can get to help with that, and the rest would be coming from the general fund side. And getting back to the question of the 70 million, so on the right, on the G column there, we have that if we were to finance $70 million, we would need 1.75 to finance this. This would have an impact about $35 annually on a home valued at taxable value of $200,000. And it would have about a $2.92 monthly impact on a homeowner. And Mayor, at this point, I would ask, I know we plugged this in right now. Would you like me to hold on until the very end to plug in the numbers and then continue with the presentations? Or all the presentations and at the end come back and try to make the decisions for the amounts that we will be considering?
Okay, you need to plug in the numbers, so we can get a more.
I can leave it in here, or I can remove it and adjust this as we go, as they make the presentations.
Mayor, I would recommend just adjusting as we go. Let's go through the entire package and then we'll come back to everything
Yes.
at the end.
Yes, I would say that. Yes, go ahead.
Items that will live as long as the bond?
Yeah, I believe Mr. Mata has some background on that as we walk through that for the life expectancy of each one of the items that we would be looking at, right?
Right, because all of the line items, like even with, so if there's
Yeah.
the question of furniture, well, that may not last 30 years.
Yes, and you will find that information on the individual spreadsheets, on that
Where?
package, on that legal form.
Oh, I'm so sorry.
That's
I
right.
missed that. I found it.
Thank
Well,
you.
but it's not, they're not all, they don't, okay, thank you.
Mayor, the next one considered with this category of health and wellness is Tina. Tina has her presentation for the Hamilton. So she can, if you would like her to make that presentation on the Hamilton's $10 million for the renovation projects that she has.
Yes, go ahead.
Good evening, Tina Martinez, Community Development Director. And I have here some information on the proposed renovations for the Hamilton. So as most of you know, our Hamilton apartment complex was built in the 1920s. It got significantly remodeled in the early 2000s and then had some improvements done in 2016. The need for affordable housing, as you all know, is great in our community. Currently, we do facilitate 165 units for elderly senior housing. So this is 60 and above. So just so you can have a little background on our senior population, usually individuals can make anywhere from $943 a month. And this is our low income elderly population. Couples, we see an average about $1,400 per month. So how does that equate to how is our housing affordable? So Our Hamilton rates, you can see there are basically a studio size is 641, a one-bedroom is 699, and a two-bedroom is 808, compared to market. So if these tenants were to go and look for apartments at anywhere at similar size, you're talking about studios 795, one bedroom 951, and two bedrooms 1,000, approximately. So how much need is there out there for our senior housing population? So we have about 300 people, senior, in waiting lists all over in different programs throughout the city. We have an estimated population of 24,000 seniors just residing in the city of Laredo. So the reasons for this funding would be to provide enhancements to accessibility to the building, of course, building improvements, some historical preservation, ensure that the community continues to see this building flourish and continue providing the service to our community. And of course, the long-term stability of these units. We would not want to lose 165 affordable housing units in our community. So again, $10 million that you'll see right now broken down a little bit more is the request for some electrical upgrades, some plumbing renovations, building repairs, fire safety enhancements, accessibility and modification, some common area improvements, and some energy efficiency. These are just pictures of what the current state of the building is. There is some elevator replacements needed, some chiller and replacements, and then entrance doors and some other issues that would enhance the building. These are just some more pictures. All our windows on that building are historic, and they are required to be maintained as a wood frame, so that is very costly, and that is a high-ticket item. These are just pictures of some of the units that we have been able to, or just an idea of how everything looks. The first, what you see on the left side is the lobby restroom, and then on the right side you see a little bit of a unit, the way it looks. Not the best accessible. What we're showing you on the left is even the doorway to enter to that restroom in the lobby area is not the proper size for someone with maybe a wheelchair, so it is kind of difficult. There is another way to get in, but again, making these enhancements would really make a difference for this population. So the request that we are requesting, or that we're asking of you today, is $10 million. We broke it down by items. These are estimates based on current pricing right now. So the faster we were able to do some of these repairs and renovations would be the best for the building. Doesn't mean that we have been trying to do some more critical items. Of course, the AC system has been something that we've been addressing. We will not wait until, certain things pass. We do have an estimated timeline. If all was approved, it would take us about 36 months to complete all of the renovations. The current financial status of the building is, we currently do have a $1.2 million revenue and expenses, so the building is self-sustaining, and of course, the repairs would allow us to generate additional revenue and properly maintain the property moving forward. There is a current HUD loan, so operations also takes that payment back to HUD into consideration. So again, why is this goal, or why is this project important? It is aligning with our Viva Laredo plan. It is improving our housing quality, is enhancing community infrastructures, is promoting accessibility. So, any questions?
Mayor?
Yes, go ahead.
Thank you, Ms. Martinez. What was the impact again to the M&O, or was there no impact?
There's not per se an additional impact, because currently we are generating the revenues to operate the building.
Yeah, so I feel like this is like the perfect type of thing to go on a bond referendum, because it has no impact to maintenance and operations. We only had $30 million for capital improvement all of last year for the entire city. We're very rarely ever going to be able to put this $10 million out of 30 million, 1/3 of the entire CIP towards this project. So this is the exact perfect type of project to put to a bond referendum, because it's purely just the renovation. No impact to M&O, actually helps us bring in more revenue. So this is, for me, the perfect type of project for us to put out there, so, thank you.
Mayor,
Yes, go ahead.
the wood frame that you showed for the window right now, do you have to answer to the Historical Society for anything that you do externally?
Correct.
And that's why you have to go to the wood frame?
So everything that is done at the exterior building will have to be actually also taken for approval to the State Historical Preservation, not just our local, but our State Historical Preservation, because it is a historically significant building. It is in the National Registry of Historical Places in Laredo.
I just noticed, I know they did an impact study on asbestos back in 2000. And I don't know if they cleared the whole building or partial of building for that.
Usually whenever it's a housing, and I don't have that information, I apologize for that, but any renovations would require us to verify that all asbestos was removed at that time, and if any impact to anything, we would take the appropriate abatement measures to address that.
In your, again, we're trying to sell something here, so I think the wording, again, in health and wellness, can we safely say that this is an elderly facility?
It is a senior living facility, housing unit. It is unassisted living, it's not assisted living, but it is affordable housing just for senior housing.
And the 43 that are waiting right now, where are they at?
They could be living on the street.
So those are the
with
applications that you have pending because you don't have the rooms available?
Right.
Okay.
And that's 43 that are just waiting on our waiting list. Throughout the community, we do see a great need for people requiring, so they might be living on someone's couch, they might be living with a family member, they might be on the street. I mean, there is so much need out
So
there.
you're pretty much at 50% capacity right now, more or less?
Capacity, all the units that are able to be rented, because we do have some units that are in need of major repair, but every unit that is able to be rented is rented.
Okay.
All right, go ahead.
How many units do we have, like, that are rented out?
Here, there's
Or that are
165.
available, that are capable?
So we do have about 20 we have 30 that are not being rented right now because they are not able to be rented. Because there is more renovated items that, like, we can't.
It's similar to everything we're seeing right now, all that, the construction, the piping and all that?
Yes, there's bigger issues than us just going in and making repairs. So it's a higher ticket price item.
Yeah.
Mayor, I have a question.
Go ahead.
When it comes to this building and somebody, we have a tenant at the bottom, like that's leasing out for a restaurant or whatever, who gets that revenue?
So the commercial units are the only ones that are not restricted, so I can rent them at market rent. So that's actually a way to generate a little bit more revenue for the operations of the building. So the rent stays in the operations of the building.
And are we fully rented out right now?
We are, except for the restaurant. All the other commercial units are being rented.
How many are there?
There is 4. 4 including the restaurant? 4 including the restaurant.
And what is the, do you have the financial, like, data on all that? Like, would this investment pay for itself over time?
Yes, the 1.2 includes the revenues and expenses, so it includes the revenue that we project obtaining from even the commercial areas.
Does that assume fully rented, or?
I mean, we have a formula to count for any unrented months, but.
Thank you.
Just one last question.
Yeah, go ahead.
Is it still Benjamin?
How much are we getting in rent from the?
There you go. Okay. Just a question. Have you ever considered putting the commercial end of it at the bottom? So we do have seniors living in there, and we have seniors living across the street or a block away, right? That's
There
another
is-
facility.
There is another facility that's not a city facility, it's a housing of, the Laredo Housing Authorities.
Yeah.
But yes, that is also senior.
I'm wondering, I'm just thinking out loud, but just, and you don't have to answer this today, but if we ever consider putting some sort of substation, medical substation at the bottom, that might be able to provide services instead of having these people go to their medical appointments or they're unable to go, that they might have some access there, that somebody will be willing to, whether it be government sponsored or whoever.
So the commercial spaces can be, again, when a vacancy comes available, we can entertain any commercial entity. So if any services can be provided there, that can be a possibility. I know we do work with the health departments, and we do ask them to come and do some information. Our lobby is pretty big, so we do work with them in that and other of our housing units to just promote any programs that they have, or sometimes just some wellness checks. Yes, we can do that, and we have done it in the past.
What impact would the city being the owner would have for the city? Maybe Mr. Hinojosa, is he here? No, Hinojosa? No? Oh, there he is over there.
Noé Hinojosa with the Estrada Hinojosa and Company.
Thank you.
We're now Estrada Hinojosa. We were bought out, so thank you, Laredo, for giving us the opportunity to come before you. And Mr. Garza, look forward to working with you. It's good to see your face on this side, on the dais. The question is, what impact would it have on the city? I think I want you to appreciate this, that if you have assets that need restoration, repairs, those are inevitable actions that you have to make. Whether you want to make them or not make them, you want to invest in them. If you put this through a bond referendum, and if you were to fail, then you're going to be handcuffed and that you can't improve it, and you know you have to do it. So very likely, like we've done with other enterprises, when we do landfills or other projects, and you know you have to do them, or else you're going to be violating codes or whatever. You look very closely at the operations. I like what I heard, that they're making money, right? So if we go out and finance $10 million apart from general obligation bonds or voter-approved bonds, because that's something you have to do, maybe we can work towards making them even more productive and attractive. The fact that she's renting some of this space to commercial tenants, we'll have to work with bond counsel to make sure that we're not violating IRS rules, but I know we can overcome those. We do the financing on a taxable basis. I don't have to bore you through that. But what's important in the context of what should be in a bond referendum, I would consider this as an exceptional project that you need to do separate and apart. Because if you were to fail, then you're going to put them in a bind that, and you have to be open-minded, right? But if you feel like you can pass them, then it's great. We'll go out there and pass them and so on and so forth.
All right, yes, go ahead.
Thank you, Mr. Hinojosa. So,
Yeah.
are you saying to do it in a separate, totally separate referendum, or?
No. You would do a certificate of obligation, just like we've done with other enterprises.
But last year, during budget, we had 30 million for the whole year.
Yes.
I think it'd be pretty hard to find a single year where all 5 out of 9 of us would agree to put 10 out of 30 million of
Well,
COs to.
I think you heard half of my story, or let me say this to you. When I give you capacity, that's to be supported by property taxes, right? Here, you have a project that is generating revenue. Okay, we need to find out how much revenue. Can we increase that revenue, right? So if we can increase that revenue, then we can pay for the mortgage on that obligation being issued for her benefit, for the benefit of this enterprise. On the other hand, if you take it on the other side, you don't need to do M&O improvements because you're doing very well on the M&O side. But if you go out and do a referendum, and you have to include them, and you fail, then you're going to put yourself in a.
Okay, so you're not talking about general fund CIP, you're talking about her as an enterprise fund. Okay.
On a self-supporting basis.
Okay, gotcha.
Mayor, can I ask a question?
Yes, go
Follow
ahead.
up to that? So, Mr. Hinojosa?
Yes,
It's good to see you also.
good to see you too. Congratulations.
Thank you. So in terms of, this project is kind of separate from some of the other ones included in the bond referendum package because it, is its own enterprise essentially, right, is what you're saying. So do we have bonding capacity to bond out for the 10 million for this project alone?
I cannot tell you that today. I will have to do an assessment of that separately. A lot of times, cities will determine from a policy perspective whether they want to go out and endorse this on a tax-supported basis, or 50-50, or no, you have to go generate your own revenues. We'll endorse you, we'll co-sign with you, but we expect you, just like we expect enterprises that we have today that we support, but they support themselves. Like we fund airport, we fund El Metro, we fund landfill, we do some water and sewer stuff. We make sure that those enterprises are generating enough revenues to pay all of their debt, including COs.
Right.
So what we need to do with them is just dive into their income statement and find out exactly where they're doing well, where they're not, with the objective to make them self-supported.
Have we ever done that for this, facility in the past?
Never have.
Never
Never
have?
have. Never have. No, I haven't never been asked.
Yeah,
So,
and Mayor and City Council, for perspective on this building, if you remember last year with the Hamilton Hotel, it was not under our responsibility. We had a housing authority that we appointed the members to. It got into trouble with not getting things fixed, not getting at all. The authority decided to say, take the building back, let us get out of the way so that the city can survive it. If you remember, all of the citizens some of our people that lived there came in saying, they were trying to bring up the rates of the rent and everything, and because they are affordable housing, that we ran into a lot of difficulty with that. And so just want to make sure for those of you that weren't on the council at the time when we had that conversation, that's why it's here in front of us today, is that it needs $10 million worth of repair that we did not have underneath our umbrella in order to eat the elephant in a different way.
Mayor, if I may?
Yes, go ahead.
So, Mr. Nab, it's my understanding that, we're going through this workshop, we're gonna get the recommendations, and we're still gonna have to vote on it in February, right? We're not finalizing the vote tonight.
We are not finalizing tonight. No, the idea here is to walk all the way through all the work that the bond referendum committee did, everything, and pull it all together to start taking the things out that you would like to have out and coming down to a very defined proposition that will go forward for May. And we have until February 14th to get
Well,
there, so.
and even if we theoretically didn't, compress it down, we could compress it down. We would have to get the final package voted on before the 14th or by the 14th, correct?
For the May election.
Right.
But, and I think that Dr. King had mentioned that, Councilmember King had mentioned that as well too. It doesn't stop us from doing another one. Our whole concept of this thing is to build a model that will work and then go out just like the other cities do and ask for help.
Oh, so Mayor, if
From
I
our
may?
Yes, go ahead.
So is it possible that we could get this financial work done on this structure, on this building alone, like Mr. Hinojosa was talking about?
Yeah.
To consider, maybe it wouldn't need to go as part of the referendum package if it could qualify for the repairs on its own separate, way.
And Mayor and City Council, we've been working with the Hamilton Hotel for a while, so has Mr. Hinojosa, because we had looked at providing it to another entity in order to manage it and maintain it as their asset. We couldn't come to terms last year. They still have some interest in there, but we have all the repairs that we have to make, and that's why we're there. So I would say, yes, I think we can get to the information because none of us we've been involved in this building for a little while because you guys looked at it as we were looking at trying to sell it to somebody to utilize for affordable housing. It's just it's really looking at exactly what you're asking for and putting that information together. That wouldn't take long.
and I'm being corrected by counsel here that my impression is that we do have a HUD note, right?
Yes, sir.
So we owe money to the federal government. And my impression was, okay, if I need to improve $10 million, I'll go back to HUD. I don't need general obligation bonds. I don't even need COs. I can go do a note with them. But what I'm being told is that maybe we cannot go back to HUD. We'd rather go out and get the GO bond authority so that if in fact HUD denies lending you that money, that then you go to the voters and you sell a GO bond for their benefit. So we're kind of acting real quick. So I go back now to the fact that you may want to have it on the voter referendum so that even if it fails on the voter, which is what I was saying, if it fails, then you can go to HUD and say, okay, let's go and do a note. Because if it fails, you're only prohibited to issue COs.
That's correct.
Not notes. So I was just telling the counselor here, a lot of counselors play with this stuff and they can make your life a little bit
Yeah,
difficult.
and so Mayor, going back to what Mayor Pro Tem had said, I think putting that information would be together. Our recommendation would be to try to correct this issue as we bring it in there. It's a very important building for us, and I think those families would appreciate that as well too, so.
I go back and I'll tell you, not the first one to tell you, let's get it on the referendum because I think it'll make sense for a variety of reasons that have nothing to do between GOs and CLs, and if it fails, maybe we'll go to HUD and say, hey, we tried it and we gotta fix it through this note. And note doesn't reply. So thank you for bringing me up.
Thank you.
Mayor?
Yes,
Mayor,
go ahead.
I have a couple questions. Were any other affordable housing projects considered in terms of developing new affordable housing units?
Yeah, and Mayor, to answer the council member's question, no, we did not look at any other affordable housing because we had this one on there, and because it is such a consolidated large amount, we stayed with operating with, because we knew we were bringing it back in. The authority is still dissolving. It takes a little time to walk through HUD for that as well too, and so the whole nature of this thing was that this was the one that we knew we had people in today. And that was why we didn't look at a lot of others for that.
Well, just there is a need to expand our
There
affordable
is.
housing
Yes, ma'am.
units. And this would just, the same residents would stay in the same, so we're not,
Well,
aside from the, was it 30 rooms that,
so Councilmember, I think, so we do have about 600 affordable housing, affordable and obtainable housing already in our operating system. They are not in this need of repairs, like, so the issue is that if we do not act now, we will lose 165 units of affordable housing.
Right.
On top of the growing need
Yeah,
on a
and
daily basis.
if I could, Mayor, what the council member is asking though is that if we would have looked at it in a larger fashion because of new affordable housing, because we have 600 and some odd units, we probably should have more for a population our size.
When I just find it very disappointing to see Parks and Recreation at 80 million and not even looking at affordable housing on a grander scale. And that is a need more than all the other, everything else.
Yes, ma'am.
I know Parks needs, there are needs there too, but when it comes to priorities and
Yes, ma'am.
wellness.
And the nature of all of these activities and these projects that have made it on there, they were in conversations at council at one point or another. I think some of the ones that were adjusted in the Parks and Recreation came from a conversation on Monday as well too. So again, this is going to the voters for a request saying, can you support something of this nature? And I don't disagree with her. Councilwoman is very correct that affordable housing we need to do a lot better with. And that is one of my priorities as well too. It was just for this bond referendum, this is how why we got to where we're at today.
All right.
But I don't disagree.
Yes, go ahead, Councilman.
So we just heard on 2 occasions right now, and thank you for the enlightening us on this issue. Very important for me personally, maybe not everybody else, but you just had 2 separate occasions where the what if was brought up. And I think that's very important from this point on with everything else that we're discussing, that if we don't have it in mind that this bond referendum doesn't pass, what are we gonna do? And I think that's part of the information that should come before February 14th. You know, that we need to have, if this doesn't pass, we have this other option. And because that makes it easier for us to determine whether or not the other items that we're looking at might not have any other, you know, choice other than this. So if we can, this will eliminate and separate, and I just ranked everything right now for myself, because you have options other than this. And some other issues might not have, so it might be a good idea to break it down into, okay, if this doesn't happen, we have this. And it'll just, I mean, it's all coming together today, right? About how, but if we don't have those options, we have no other choice than to go forward and move forward with this. And if we don't hear about those other options, then we're gonna go in this blindly, and we might get caught off guard. So if in February you can break it down into those things, it'll make it a lot easier for me at least.
And Mayor and council member, I think that was the intent, is rather than to do a lot of what ifs for everything, once we get you narrowed down and you say these are the priority ones, we'll be able to get you that information very quickly.
Okay.
We have been working on it.
Okay.
All right.
Thank you.
Thank you.
Appreciate it.
Mayor, the next department that we have is the paving program, which is the public infrastructure. Mr. Ramon Chavez will be doing that presentation for you all.
All right. There we go.
Honorable Mayor, members of City Council, Ramon Chavez, Assistant City Manager. For the record, as part of the original packages, you were supposed to have this presentation. If you don't have it in front of you, I have copies here for everybody, so
I don't think it's changed, right?
Okay.
Salud.
may I continue, Mayor?
Afternoon.
Okay. And thank you again for having us here this evening. And before I start, I'd like to, first of all, thank the Bond Referendum Main Committee members for their commitment to our community, and also in particular, the members of the Public Infrastructure Subcommittee, which I see our chairman, our vice chair, and our secretary in the audience, so that means a lot for them to be here present. Tonight, we will be discussing the proposed pavement maintenance and preservation program over the next years, and that's a presentation that you have here before you. First of all, just to give some general information, our city consists of approximately 856 miles. I know we always talk about that number in the 900 miles, which approximately 86% are residential roads. From there, you can see on the screen, we have a map, an interactive map that is available to the public. through our open portal.
Yes, go ahead. Question.
Mr. Chavez, I'm sorry to interrupt. When you're talking about the 856 miles, we know that there are a lot of TxDOT roads. Are those roads included in this plan?
Mayor, if I may, no, they are not included. We're only talking about city roads.
Okay, so 359, Clark right now, until it changes, all of that, anything that's TxDOT is not included in these
That
mileage?
is correct.
Okay.
Yes, that information is not included. So if I may continue, so the slide that I was showing a little while ago is an interactive map based on a study that was conducted in 2019, where the public, through our open data portal, is able to see what the pavement condition index is. You're going to hear me say a lot PCI this evening, and that is our pavement condition index, okay? Which is a rating system for the condition or the general condition of pavement roadway systems. Okay, so when you hear the word PCI, that's what we will be referring to. Let's see if I can escape from here. Okay. So again, in 2019, our average PCI was 73.2, and I will get a little bit more into that number on our next slide. Based on information that we received on that report, given a $4 million budget scenario, which is very close to the average the Public Works receives or has received over the last years. With that being said, currently we estimate our 2024 average PCI to be 61.80, okay, which has dropped significantly over these last couple of years based on the information that we have on that report with a $4 million budget. Next, we have again the pavement maintenance and preservation program, okay, and the preventive maintenance techniques that currently exist to preserve our pavement infrastructure. The PCI number is based, it goes from 0 to 100, and if you can see there on the different categories, based on the PCI number, the street is classified either as serious condition, poor condition, fair, satisfactory, or good. Under there, we have the estimated number of miles that exist through our city. And below that is the different types of maintenance techniques that are recommended for each individual, under each individual category, whether it be crack sealing, which is at an early stage, microsurface or slurry seal, milling and overlay, which is a common practice right now, reconstruction, where we have to go into the base repair, or major reconstruction. From there, if you can see on the information underneath, the longer you take to maintain a street, the more it's going to cost you. So looking at residential streets, and these are numbers that we calculated per mile, under preservation, you may preserve a 1 mile of residential street for $68,000. An arterial road for close to $200,000, and industrial one for $150,000. And the difference between the arterial and the industrial is that an industrial street is narrower than the arterial. So that's why the cost there. As you move on, the costs keep increasing. If you go into the milling and overlaying, which starts going into rehabilitation, or major reconstruction, which can run from 1.4 million and all the way to $4.2 million per mile if you're looking at a concrete industrial roadway.
Mayor?
Yes, go ahead. Question?
Just, Mr. Chavez, if you could go back to that slide, just to, right now, generally what our Public Works team is doing is the milling and overlay, correct?
That is the current practice.
Okay, for pretty much.
Yes.
Okay, thanks.
We have recently, and again, I want to thank my staff and Public Works, which we have been working in coordination throughout this process with the committees and presenting some of this. So our recommendation is to allocate $30 million, of which it is recommended that 30% of that go into preservation and 70% go into rehabilitation. So from there, our estimates, for example, in 2024, with current prices, we could be able to preserve and maintain and rehabilitate or reconstruct up to 83 miles of roadway with that amount of money. And subsequently, the years after that will increase, or rather start increasing there. So funding, right? And what do other cities do as well? So I did some comparison analysis with our staff, and we looked at what we do, for example, in our city, which we do between $4 million and $5 million annually, approximately. City of San Antonio, which of course is it's a bigger city, they have 4,200 miles of center mile roadways. They annually do 90 millions that they allocate for funding, and they bond 20. City of El Paso, which has 1,100 miles of roadway, they allocate $10 million annually. And a City of Corpus Christi, which has 2,100 miles, they went out on a bond referendum in November, and they passed a bond of $89.5 million for roadway improvements, drainage, and sidewalks. That is my presentation, Mayor.
Yes, go ahead.
Mr. Chavez, if you go back to the previous slide, if you don't mind. And you mentioned that the city does $5 million annually, but that's only been for the last 4 years, right? So
You're talking about our city?
Yeah,
Yes,
we've only
correct.
been doing that $5 million annually.
Yes.
And it's even hard to get through all of that, but so just to be clear, it's like, this is a very recent thing, because there were years where we didn't even have basically any money for paving whatsoever.
Correct.
So we're extra behind in that. And I printed off for I asked my assistant to print off for my colleagues, City of San Antonio's 2022-2027 bond package. And they've been doing a bond every 5 years since 2007. They did 2007 to 12, 2012 to 17, 2012 to 22, and now they're in the middle of implementing their 2022 to 27 bond package that was passed by their voters in May of 2022. And if you look through their Streets, Bridges, and Sidewalks Committee final list of projects, and of course I understand they're significantly larger, right? $477 million towards streets, bridges, and sidewalks. And in each of their districts, they allocate approximately 7 to 11 million of streets reconstruction. And I think that's the main thing, is this is about, reconstructing roads, not just what we're currently doing, with the milling and overlay, which that's important, but there's a lot of these roads like Del Mar, that Councilmember Gutierrez and I share, and Councilmember Perez, that a lot of those completely just need to be reconstructed altogether. Because I know the argument out there is, why would we go out for a $20 million bond for something that's only going to last 5 to 7 years? Because that's what a lot of our roads do last, but that's because we're not funding enough to do the actual reconstructing of these roads. So just arguing in favor of more of the reconstructing, rehabilitating, because that's, like you said, so much more costly, because we've waited so long to address some of those issues. So we're paying for past issues.
Sorry, Councilman. If I may, Mayor.
Yes.
I'd like to just go over the motion that the Public Infrastructure Subcommittee made. It was as part of all this process. They made a motion to ask City Council for a charter revision amended at the next charter election ballot for a 5% of property taxes collected to be designated for street paving, and add 30 million on this year's bond referendum pending Public Works for streets paving as amended.
Mayor, may I?
Yes, go ahead.
Mr. Chavez, just comparing ourselves to San Antonio, I don't know, in this presentation, you do not have the streets designated specifically. And in the San Antonio comparison that we received, every street is laid out. It's also aligned to council districts, but it talks about the amount of money and also the exact street that will be repaired. And I think they do that as a measure of accountability, because if you're going to put so much millions of dollars, then you can go back and say, well, did you actually do these streets? Do we have that? Do we have a list of streets that have already been targeted? If the 30 million were to go through, that you would be able to say from, you know, X block on Concord Hills Boulevard to, I just got paid, but X block on Concord Hills Boulevard to X block will be repaved, rebuilt. Understanding you've got the map, so do you have the monies allocated to these specific roads already?
We don't have the money allocated. Again, Public Works gets, as I understand, receives between 4 and 5 million annually. And
No, I'm talking about for the proposed bond.
right,
If
we
you'll
do
list-
have a list, yes. We
Yes.
have all these streets that you see on the map, they're on a list that we have with the current condition of each street. So that list would be part of the analysis moving forward. And you are right, when I looked at other cities, which will be something moving forward as we proceed, where on the actual ballot, they list all the streets. They list all the streets, and that won't be a problem for us at all, because all that data we have available
I think
at our
it's an
fingertips.
important part, it'll be my last statement, it's an important part of being able to convince the public that there is a need and that there is a measure of accountability, so that when we go in and we ask them for this money, that they can see where their money is being spent. If we're tying it directly to streets that coincide with this analysis that you've already done.
Of course, and that would definitely that won't be a problem, it will be part of the analysis, and I would recommend that we do as such.
Councilman Legamon.
Mr. Ramon, is there a possibility that we can do, just like my colleague said, my colleague Cesar Ross said, that we can get a similar, as we can see, break it down through council and districts, see which areas being more affected. I know some areas, especially in the Mines Road areas, there's a lot more traffic coming in, coming out. You know, if we can work in, around McPherson, Delmar, which some of them have high traffic. Can we get that, broken down into two districts just like this? I don't know if you can give you a copy and show you. And so, like Ms. Cigarroa said, so we can show the public where we're spending our money, and where our, where we're going to be more concentrated and putting this monies to.
Most definitely, that is something that we can do. One of the things that I will state, as you move on and proceed into that process, you get into a deeper analysis, right? To where right now, we're estimating based on the conditions, not only of the report, but a visual inspection. And so you will only get too far, but we would be very accurate. But once you start getting into a deep analysis, into details, we may be able to reduce that amount, right, based on that same analysis, so that we can get more for our money, of course.
Yes, go ahead.
Just a couple of questions, Mr. Chavez. First of all, Public Works does a phenomenal job when it comes to specifically with the money that they get yearly, $4 to $5 million a year.
They do.
But when it comes to materials, it's become a problem, and you all know about this as well. So if we're not able to get so much material when we're investing $4 to $5 million a year, what are we going to do as far as supply chain is concerning the asphalt itself? Because some suppliers that we have now simply can't keep up with our demand. Right. And I've heard that it takes months sometimes to get it because our state has been taken over. And of course, their projects are way larger than ours are. So I understand that. But what are we going to do as far as that's concerned? Or is the $30 million just going to be sitting there? And I know Public Works does what they can with the material, the crews they have, and their equipment. But what are we going to do if this should pass and we don't have the material?
In my opinion, it's going to have to be part of the scheduling. it's gonna have to be a strong schedule where we, ahead of time, allocate and make sure that we have those materials available.
Allocate, I'm sorry, just to follow up.
Yeah, go
So, will we have different companies able to supply us with asphalt should we need it? Or is there only one supplier available here on Laredo?
No, there's a couple of suppliers. I don't know if Mr. Orfila maybe can ask, he's the one that purchases these materials, and maybe he can elaborate a little bit more on that information as far as that is concerned.
Thank you.
Mr. Arfila?
Mayor, members of the commission, John Orfila for the record. Keep in mind that the majority of it is not going to be asphalt. Again, these 30 million, we need to, well, the city really needs help is in our golden goose, which is our industrial parks, would provide some money to the city. Our industrial park, we want to invest in concrete. As far as concrete, we have several. Back then, we were in danger as far as concrete companies, but now there's more than 1, 2, 3, 4, 5 of them now, and there's more coming. I know because most of them go to my office. So the majority of it's going to be concrete. Asphalt is not a problem. Yes, sometimes the plant does break down. Sometimes it rains and the material's too wet. But while that's happening, we're milling. By the time it dries up, we move.
So we have another supplier on change?
There is one that's a mile marker 15, 16 on the other side of Unitech.
Okay. That's our main supplier or that's our secondary?
That's our secondary.
Okay.
Yeah, we try and stick to the local one here closer because again, by the time the truck goes all the way to 18 and we're paving in South Laredo, we're not gonna get much done. We did that years ago. And again, the trucks, the wear and tear on them.
So with these initial $30 million, should they be invested, then you're looking at doing more industrial roads?
More industrial, yes. That's where I need the help. I think the city, I'll compare the city of Laredo to any city in Texas as far as our city streets, very good condition.
Oh, yeah, absolutely. Thank you.
Thank you.
Thank you.
Yes, go ahead.
I just wanted to say, Mr. Chavez, do you anticipate, if this were passed, what percent of this money would be, implemented with road construction re-improvements by Public Works versus bidding out projects? Because as it is, Public Works, with the staff that it has,
right,
the $5 million that we currently allocate for it is pushing it for them to be able to get that finished with our current staff. So
right.
I imagine we would need to be bidding out these projects.
Yes, so we've had brief conversations with Public Works, and they've been a part of this throughout the process. We've met with a couple of contractors moving forward, getting some prices. And keep in mind that the prices, that the unit cost that we show here on this slide, these are contractors' prices. Okay, these are contractors. So I feel it would have to be a combination between the majority of the percentage, perhaps outsourcing it, but Public Works being still part of it. Yes, a combination of.
Mayor, go ahead.
Mayor, I think Mr. Russell was next, and then.
Yeah, go ahead. Mr. Chavez, there's a couple of things that I wanted to talk to you about on the PCI, the drop in 5 years, and compared to the map that you have, there's certain specs in there of new development that are deteriorating at a faster rate, for lack of a better word. That is one of my concerns about. We are going to repave some of the streets as Mr. Orfila said, more industrial work. My concern is that some of this money is going to go to areas that have a high deterioration rate over a period of time. When you go into this bond series, you have to be thinking in terms of the ultimate or the end result in terms of years in payback. So if we're not going to have a life expectancy where we go from satisfactory to poor to a 41 to 55 PCI, then we certainly, I think, should consider that doing our part as a city, that we might have to change some of the specifications when we go into new construction and new areas, right? And it's kind of a bad word to say right now, right? But there's got to be a way that we can start thinking ahead, that we don't have to put so much stress on our Public Works Department and getting some of those things done when we know it's gonna happen. And so the idea when you go to bonds is to make sure that the quality and the life expectancy of what you're gonna get is gonna meet the time demand that in paying back those things. So in that consideration and doing all of these type of things, I noticed that and this town is divided into different areas. Some are of high clay concentration. There's other engineering tactics that you need to do in order for them to get it done. This, I think, will be a golden opportunity for us to say, okay, we're gonna go out to tell the public to give us money to redo this, but we need to do it right this next time around. So my question is, in some of these areas that are not meeting the threshold of deteriorating at a faster rate, would you say it was a lot of it had to do with engineering, quality control, or is it just the engineering specifications, quality control, or just wear and tear?
It could be wear and tear, but what we are identifying here on some of the recent construction is the types of soils and also irrigation systems. And that's something that deteriorates our streets in a faster way. And our Public Works has been doing a great job on for example, when there's irrigation issues, when there's issues with irrigation, they'll install a French drain, and you can see the next day the difference on what those things are. We are moving forward with an amendment to our subdivision ordinance that you will probably be seeing here soon, okay? And with some recommendations that we have already been looking at.
So and that's where I was getting to. Whenever we do something like this, it's just not, we've already identified the problem. You just mentioned it right now. We've already identified the cure for that problem. But it's gotta have to be taken in baby steps to get people used to this type of thinking. Because I know that everybody's gonna take a hit after that. The increase in development cost is gonna be passed over to the people that are buying the lots. So, and I get that. But I think long-term, it'll bring down the cost of us going out there and having to repave and repave and repave, and we just never catch up. So that's the point that I'm trying to make, and I think integrating this plan into your day-to-day operations is gonna be crucial, but remember, we have to also take into consideration a lot of things instead of just implementing on one day or another and let the chips fall where they may.
And just one comment, if I may, Mayor, in 2017, just so that everybody understands, there was an amendment to the ordinance to reduce our pavement standards. So that's something that I have already, I'm sorry?
Yeah, that goes under quality control now. See?
Yeah, so that was passed by council in 2017. So I already mentioned some of that to our city manager and our team. Again, and we've received direction to reevaluate that, to bring it back so that council can also have that information.
Thank you.
Mayor?
All right, go ahead.
Mr. Chavez, the presentation is very comprehensive, and I'm very glad to hear that you're looking at increasing those standards. I know I've had discussions with Mr. Orfila for some of the neighborhoods, some of the new neighborhoods where you see streets that are failing, and it is the people that end up suffering, right? The people who bought the houses that have issues now with their neighborhood streets. But I'm wondering, do you think that by May you would be able to have this street-by-street designation and the amount of money that it would cost laid out for the voters to see? Or do you think that this is something that should be brought perhaps in November so that all of this information can be collected, that the streets will know exactly how, well, not exactly, but more or less how much it will cost to replace them, and then that can be included so that there's a very transparent view for the public to see this bond money is to repave these streets, and there is a need there, and we need your help to get it done.
Yes. No, those estimates can be prepared by me without any problem.
And Mayor and City Council, I would say that we need to have them prepared before the February date, even for the May. If we've moved to November, it still needs to be prepared out. And in my mind, I think that needs to be part of the whole conversation after we set the question.
think he needs to be prepared by next week, by when you call the
Right.
election.
That's what I thought too.
Mayor,
Yeah.
may,
Yes.
Thank you very much. Thank you, Noah. Thank you. The city
Mayor,
manager and Mr. Hinojosa are in agreement. Yes. No pressure.
Yeah. Go ahead, Council.
Mayor, in terms of, thank you, Mayor. So some of the concerns come to my mind when it comes to like investing so much money into our streets. You know, we're asking today's residents to fund, lack of investment, for a better word, over the years from the past. And we're doing that with water as well, our infrastructure. We're doing that in a lot of other areas. And so I understand that we're trying to be ambitious and we're trying to correct deficiencies from the past and everything, but all of this is going to have a cost for the people. And so we have to be mindful of that and what they can afford, right? The concern I have with focusing on the streets is that we're also trying to focus on what's under the street, which are the water pipes, right? And we don't want to shoot ourselves in the foot where, you know, I think that this program needs to be in tandem with our water pipe replacement program, because we don't want to resurface a street that we're going to later have to tear up to fix the pipe. And then at the same time, we've been experiencing a lot of water breaks, so we don't want to resurface the streets and then, you know, we continue with this high rate of water lines breaking, and then we have to go tear it up and finding contamination sources and all of these things. You know, we don't want the streets to be beautiful and then there's a problem underneath. So we don't want to be disillusioned with that. In terms of the overweights, or in terms of the industrial areas, I do like that we're talking about adding more concrete, because I do believe that if we get that formula correct, it would end up being like an investment, because we are spending money for maintenance, because the initial streets that are constructed are not adequately able to handle the traffic that we have. We have the problem with trucks that are overweight on our streets, that are not in the overweight corridors, which are also tearing up our streets at a higher rate. And then at the same time, we have the irrigation issues in the industrial parks that are also adding to the wear and tear. So if we're still going to have the irrigation issues and people not, you know, people, like, it's hard for us to keep up with enforcement on all of these things. If we're still going to have that on our newly beautiful resurfaced streets, then I don't like the idea of throwing money to fix problems that you're not really getting down to the root of the problem. And so I think that we have a lot of trucks in residential areas as well, which are also adding to the wear and tear. And, you know, we're the largest port and we brag about that, but that comes with problems, and fixing and resurfacing the streets is a nice initiative, but if we're not taking care of what's causing the damage, then we're always going to be playing catch up. And I don't like the idea of asking the taxpayers to pay for resurfacing without having a plan for making sure that when that street is fixed, it's going to stay fixed for as long as possible. So do we have data in terms of how much money we would save from maintenance over time if we were to invest the concrete into these new industrial parks now? Because I think that number for me would be very palatable, and I think that would show a way that this would pay for itself. And then I'd like to see how we plan to tackle the irrigation problems and how we plan to tackle keeping the trucks out of the residential areas, and also to see the water replacement plan in tandem with the street repaving plan, so that we understand and the voters understand, look, these are the streets that are, you know, on the far right spectrum of this highly critical, like very, very neglected.
Right.
We need to finish and fix these first. At the same time, you know, within the next few years, we're going to be replacing these pipes on these streets, so we're going to resurface those later. Kind of, I mean, I think we need to be very organized and coordinated here, because I don't want us to just throw money at good faith illusions, right? We need to make sure that we're being smart about the money that we're asking for and that we have good plans for them. And right now, I see a lot of conceptual, theoretical, or good like needs, but the departments have to kind of coordinate on these asks a little better.
Mayor?
Yes, go ahead.
Thank you, Mayor Pro Tem, for those comments. And that's an excellent point. And I feel from our end, it'd be irresponsible if we don't do that analysis because we'd be throwing our money away pretty much. And so that coordination already occurs between Public Works, utilities, and other companies to understand and so that they know that before we do an improvement, we want to make sure that you have good infrastructure underneath so that we don't get into these issues. Because that, in my opinion, it'd be irresponsible, but that's coordination that it's already happening between Public Works and other utilities.
Mayor, if I may.
And we would definitely have that. We received a preliminary plan from our Executive Director of Utilities where we're looking at all that information of which lines are going to be replaced so that also we can consider that.
Go ahead, Council.
Can you transfer that knowledge to us so that we can see it? Because I think it would be
Yes.
helpful for us if we're gonna talk about like listing out the streets that need
Right.
it. It would also be helpful for us to
Yes.
see the plan, the bigger picture, so we can understand like, you know, that we can feel comfortable advocating for this and it's not just gonna be money that's gonna, like, we're gonna repave a street and it's gonna get torn up in a year
Correct.
or,
Yes,
you know, we have a good plan because we do have the water issue.
yes.
Mayor?
Yes, go ahead.
I completely agree with Councilmember Perez's concerns and making sure that we are addressing all the issues that cause our roads to be so easily destroyed so quickly. I do want to just remind everybody that if, you know, and I'm open, I've heard there's ideas of, you know, I've heard the idea of maybe we should, you know, pushing this back to November until we're all ready, but I do want to also say, even if we do it in May, if we do it in November of this year, May of next year, November, well, you don't want to do it in the middle of a regular election, but the point is, the money doesn't come out the door. It takes 2-3 years sometimes for a lot of this money to actually get out the door, as a lot of us know with some of these projects. So, you know, just thinking about it, we would still have, you know, time to, you know, make sure that, because we're still going to have the final say on how this money gets thrown out the door, right? Once this, if this were to get passed, this just gives us the permission to do this much. It doesn't mean we have to end up doing this much. So we still have all the control about how and when and if this money even gets bonded out. So I just want to remind everybody that this is the beginning of a very, very long-term conversation over these next 5 to 7 years. If this were to go through and pass in May, just.
Mayor, members of council, Mayor, if I may address Councilor Vanessa's comments. You mentioned us resurfacing streets that possibly have a lot of line breaks. If I were to stop paving those streets that are heavily been bombarded due to line breaks, and again, the last time we had an aggressive infrastructure replacement as far as water and sewer, that was back in 2014, 15 when it stopped. Imagine if I stopped paving all those streets that are bombarded. I mean, so again, not till we have that program going strong. If you tell me, for example, I'm going to use Market. I resurfaced that back in 2007, 2006, 2007 or 8. If I don't resurface it like I have been in sections, imagine how that roadway is going to be for cops, ambulances, heavy traffic that pass through there. So again, I coordinate with utilities, we coordinate with the gas companies and everybody else. But if I do not hit it and get it cleaned up, you're going to get the calls. So if there is a program where we're going to invest X amount of millions, we have those streets, we will leave them behind. But if they're not in this scope of work for the next 5 years, I got to do something for the people who live there or the people who drive through there. So just take that in mind.
Anything else?
That's it. Thank you very much.
Any other questions? No? Thank you very much. Yes, go ahead.
Good evening, Mayor, City Council, Roque Vela Jr. for the record. Let me start by a couple of things. I was not aware that the minimum standards for payment had been dropped in 2017. In 2016, we were actually working to do the opposite, to raise those minimum standards for certain areas of the city, depending on what soil standards you had. We got a pushback from the developers there, so then the next thing was to have them put French drains in there in certain areas, to the point that FEMA was even willing to give them the French drains. They weren't willing to do that either. You mentioned the Fruit Coast lobbyists earlier that are very strong in this nation. Well, in this town, it's the developers. And I'm not saying it's their right, but I'm just saying there's going to be pushback if we try to do that. So the point is, there's going to be issues with our street pavement. Rebuilding them or not, there's going to be issues because of the type of soil that we have in certain parts of the city. To touch on Mr. Chavez, that was not the recommendation of the subcommittee. The subcommittee actually, let me back up a little bit. There was two other recommendations that weren't in line with what you asked us to do, but we took the opportunity after we had voted to recommend zero. So we took the opportunity to have some other alternative ideas, if you will. We looked at Mines Road often, for obvious reasons. We figured the over-under on bringing that to interstate standards was $1 billion, and that's just a starting point, which obviously is way too much for us to chew. So we had talked about a program to run fiber for the stoplights, so that the stoplights could be more in sync. Minimal cost, I think it was like a $2 million cost. We thought obviously too little to bond. So we voted and recommended that the RMA take on that project so that they can go in and make those lights more efficient. Also, FM 72 is just that. FM is farm to market. As we know, Mines Road is not a farm to market. Farm to market is a road that you see going to Mirando. Mines Road is not that. So we also recommended that the city council vote on a resolution to also the county, in partnership with the county, to make it a state highway. That's a process that you need to do to take it to TxDOT, and then TxDOT could turn it into a state highway, and that'll increase the possibilities of funding. So those are two of the recommendations that we asked for. And also, we recommended zero. And the $30 million number came from, because of the first time that we recommended zero, the main committee did not like that, and obviously, frankly, didn't believe that that was the recommendation. So when we passed the recommendation for you about the taking 5% of property taxes and dedicating that to street paving, that was all with the caveat that I would go back to the subcommittee recommending $30 million. I would not agree to it unless the subcommittee also agreed to it. I wasn't going to speak on behalf of my subcommittee. Went back to the subcommittee, and the recommendation was again a no, zero recommendation. And it's not because that we don't think that there's a need. There's definitely a need. We just do not like the idea of, again, to the point, and it's been brought up before, of financing something that's going to last 5 to 10 years with a $20-year note. A $10 million note is going, and this is the rationale behind it. One of the reasons is when I was a council member and I'd go to HOA meetings, we'd get a lot of complaints from some of the more affluent neighborhoods complaining that their streets weren't up to par, and they'd say they pay a lot in property taxes. Well, my only answer to that, as you know, is property taxes are already dedicated for other things. But that wasn't a good enough answer. So in going through these different committees, as you know, we brought this recommendation before in front of council. That's where my idea for that. But also, if you think about it in just a numbers standpoint, a $10 million note over 20 years is going to be about an $800,000 payment a year. So why are we kicking the can down the road? If we understand this is going to be an ongoing problem, we need at least $5 million a year to be able to maintain our roads. Why are we going to finance something for 20 years? And that's just $10 million. If we do the $30 million that you're asking for, you're talking about $2.4 million. So that's half, just the payment. for 20 years. That's half of what we're already asking for. For some, it's in the last 5 years. So when we have a whole new set of council members, you're gonna be dealing with the same issues instead of thinking differently. Instead of creating some fiscal responsibility so that future council members, future councils have this nest egg, if you will, to be able to provide this maintenance and make sure that that's going to where it's supposed to go. The largest inland port in North America, making sure that our streets are to the standards that we have the money to be able to maintain those, and it's not costing us. It's gonna take some time because we have these bonds, but if we get away from financing this over the years, over the next 10, 15, 20 years, it's gonna make sense. We just have to have that faith and take that jump, which was why the committee decided to do that, because again, we just don't like the idea of financing something that's the last 5 years for 20 years. And it also, you know, whenever you get into situations where you're not making as much money as you used to anymore, then you have to force yourself to be fiscally responsible. Well, this is forcing city government to be fiscally responsible. Government by nature is not fiscally responsible. That's just the way it is. That's nobody's fault. No one person's fault in this room. It's just a collective of a flawed system. This is an opportunity to be able to take one small step to make it fiscally responsible.
All right.
Questions?
Any questions? No? All right, thank you. All right. Next.
Mayor, the next department that we have is the Parks Department. Up to this point, we've had the previous departments that have presented have been the amount that city administrative recommendation and the main committee have been in line. 70 million for health, the 10 million for the Hamilton, and the public works street paving of 120 million, which is a 30 million. We have 30 million, and in year one, we don't have anything because it's 4 years, 30 million times 4 is 120 million. Because we had already planned on that first year is gonna be planning and coming up with a program to initiate it and take it. And to Mr. King's point, the financing would then come in place on an annual basis on how much we need for that.
Mayor, if I may?
Yes, go ahead.
In terms of the 120 million, since it is a planned out, it's multiple years out, I mean, I really don't, I would be more comfortable bonding out for a lower amount now and then rebonding in the future to finish out, since we do have it allocated and then at that time, but I know there is a need, right? So I would be comfortable with, you know, a chunk and then coming back to rebond out for public works, infrastructure, repaving in the future, so that we don't have to do the whole amount at this time.
Yes, go ahead.
I will agree with you, Ms. Councilwoman, Perez, because, you know, getting this amount for 120 million, it's a lot, you know, and then we haven't fixed our mistakes yet. So until we fix what we have, you know, I think we should just start off small and then gradually wait from there. And look at the other hand too, as well. So.
And Mayor, that is certainly the prerogative of the council and one of the choices that is hopefully gonna be made today so we can move forward. So any adjustment that you all feel that would be able to pass, or we can move forward. So it doesn't necessarily have to be those 4 or 5 year program in there, but I do think it is crucial that we initiate something so that we don't fall behind which is what has been happening right now. Like I mentioned, the next department is the Parks Department. This is the department that did have some adjustments based on our last meeting. There were some projects that were added in there, and Mr. JJ will be presenting his presentation, which does not have all the updates that we've done today. So when he finishes his update, and if you look at page 10 of the handout, you're going to be able to see there what projects are in there. We can come back and discuss that when he does his presentation. So.
Good evening, Mayor, Council. Thank you for having me here. Again, like Mr. Esparza said, this is the presentation that I presented to the bond committee. There are some items that were taken away, and there's some items that were added recently, so that are not been here, that we can I guess can be discussed after. So, I think I give you a copy, or let me just to go over the. So we identified the eight items that we were looking for, that we're looking to for our department. Number one being the administrative office and warehouse that we have. It's outdated. It's over 60 years old. We're very short on storage. One of the biggest challenges is that we're not centrally located as far as as you all know, we're located off of Piedra China in South Laredo. So we're growing, so we're trying to find a more centralized space, more central area, so that we can have this building and accessible for the citizens here for Laredo. The second item to identify is, as you know, we always have troubles with fields and all that. We're possibly putting some artificial turf on some of the fields for easier maintenance and for less M&O that we have and more cost effective. LED lighting systems for different trails, Zacate Trail, Zacate Creek Trail, Chacon Trail, and other trails that need to be added from Father Magnoble as well. Surveillance cameras that we're starting to add to the parks for safety. Where now we have 100. Our goal is to put 100 cameras every year to different parts of the park, and we just don't pick it out randomly. We collaborate with PD and to see where parks are getting the most vandalism crime, so that we have a task force to where we're going to put the cameras for safety for our citizens, which is good. A lot of people are using our parks, and that's good to hear. Good to see that. The next thing, I know we took it out, but the 3 Points pools in South Laredo was taken off. Lighting along Zacate Creek at the trail system, the open space master plan suggests that for the Viva Laredo comprehensive plan, the need is great for lighting our systems along Zacate Creek trails. It's about 6 miles long. Chacon Creek will also be wanted to be added in there, as eventually we want to get the trails more lit up for both of the main trails. Last one, the last one that was from our department is the construction of a rec center for District 6 and 8. As you know, we do not have a rec center in District 6 nor District 8. These communities have voiced concerns about being these only districts without a rec center. And then the last thing we put there as a request is, I know people, it was about the water park. The water park was part of the Buena Vista Sports Complex. We have the land there. It was unfunded. The money was to move over to finish the sports complex, the Buena Vista Sports Complex, which is being handled right now. So these are the eight ones that we brought up to the, as you can see there, a checklist of the 8 that I just mentioned. From the relocation administration, the turf, the LED sports lighting, the surveillance cameras, reconstruction pool, which that's taken off, the lighting of the creeks, the construction of construction rec centers in District 6 and 8, and a water park in Buena Vista Sports Complex.
Mayor, may I?
Yes, go ahead.
Mr. Gomez, the top item, the administrative office and warehouse that you have budgeted, I think, for $8 million.
That's correct.
Do you have plans for that? I mean, we saw extensive plans for the police facility and also for the health department facility.
Right.
Do you have plans?
No, ma'am. We do not have an actual plan. And let me add that a little bit to that. The $8 million was with the possibility that we already had the land. So we would have to search for land. So we're looking at another $3 to $4 million to purchase the plant. What you'll see at the very end, I added that to the end. Have we had a design and construction? No, we have not. We have some ideas that we've seen through other areas that, if allowed, we would definitely have a construction design. So we don't. To answer your question, we do not have one right now.
I think perhaps this is also a discussion that this could wait for November, simply because it seems as if the projects that are being presented to us are highly detailed. And I think when we're presenting it to the public, they do want to have a better understanding of exactly what their monies are going to fund. Not that it's not needed, but that you know, it sounds as if it would take several months to get to that level of specification so that the building would meet your needs for the future.
Right.
And so maybe waiting is not such a bad idea.
Okay.
Go ahead.
If I may ask that, just to elaborate on that question, I'm curious from bond counsel and/or financial advisor, Mr. Hinojosa or Mr. Juarez, you know, what's normal when, you know, how much of a project needs to be fully designed before you can put it to the voters, or can it be conceptual in nature, detailed in a way of where it would go or and who it would serve, or is it standard to have the design completely finished by the time it goes to the voters?
Sure. For the record, Mayor, Honorable City Council, my name is Jay Juarez. I'm an attorney with McCall, Parkerson, Horton, and I have the privilege of serving as bond counsel. It's not really a legal question. It's more of a matter of preference. I've seen it done both ways. Sometimes they have everything drawn out to a T at the time of ordering the election. Sometimes they kind of figure out the details of what they want to present to the voters a little bit afterwards, because most of the time the information that's communicated to the voters isn't actually in the measure and the proposition. It's in the materials that get out, distributed via other methods, their website, you know, mail outs, stuff like that.
Right, because I imagine, you know, a lot of this stuff can be very expensive to design if you don't have the guarantee of the funding, and sometimes the funding is for also design as part of what you get funding for in these bond elections, right?
That's correct.
So it's kind of difficult to expect full designs or even partial designs when you don't have the money yet, which the bond election gives you. So I just want to point that out.
Mayor, may
Go ahead.
I think more the intention of my question was to understand what the specific needs are. Because, you know, perhaps the health department, they've been thinking about this for a long time and they seem to have really detailed plans. But I think what we saw in the police department headquarters was just really a listing of their needs, very specific. And I think that if we're intending for this facility to serve for the next future years, then having a breakdown, I mean, it's a good exercise to go through so that you know exactly what you need. You can forecast what your future needs might be and make sure that the facility will end up serving or fulfilling all of the needs that you have. And so less of a schematic design, or actually I don't understand the definitions of the different types of design, but having a good understanding of what your needs are, you know, the space that you'll need, and if this piece of land that you think that we have will serve and meet that. So just a little bit more specific so that we understand exactly what you're looking for.
Okay. Somebody asked me, the building is 60 years old, so with where we're at right now, so it needs a
Mayor, if I may.
Yes, go ahead.
So, Mr. Gomez, thank you for this
Yes,
work. I do have a question on your LED lighting request because I see that as an opportunity for potential return on investment there. I'm looking at your slide where you elaborate on the lighting, but there's no mention there of cost or potential savings or at what point we would hit that return on that investment. I know that was one of the reasons why we chose to invest in full LED lighting in the rest of the city. So I think going full LED would be a good idea just to keep it consistent with other projects that we've had. And I know that when we decided to go fully LED on the city, the return on investment there was about $250,000 a year for a $1 million investment or something. So I would like to see the numbers, if you could tell us, like at what point. 13 million for the request for the lighting, but at what point are we gonna hit that return on that investment?
The return on investment.
Right, because if we're gonna be saving, so many million a year in lighting or however, I just don't know what that looks like. But I would like to see that, and then also, you know, maybe even projected, like, or, if we're gonna, you know, have issues with some of the bulbs burning out or something.
Right.
Also on the turf side, when you're talking about turf, you mentioned here that you compare the cost of the turf to the cost of the maintenance in terms of that. However, I don't think that this accurately shows the risks of putting turf, right? In terms of the damage with the heat, possible theft, possible upkeep issues when people are used to taking, like, for example, their pets to the park and they're not used to dealing. I like the idea of having turf in controlled environments like the Unitrade, or having it like at facilities that we can kind of manage how it's being used. Because I know we did have that issue where the turf was damaged and it was a huge replacement cost.
Right.
So I'm not too comfortable with the idea of putting turf in open fields that are subject to, you know, the elements.
Right.
These turf fields would be open access, nobody would be monitoring them.
Mayor Pro Tem, so these fields that we are identifying are fields that are enclosed and have the heaviest use by most of the leagues, with a lot of leagues that are enclosed. For example, I'm going to tell you the first one, Slaughter Field, Slaughter Park, soccer. We have 4 leagues that play in those 3 soccer fields. We're trying one on top of the other. The maintenance and operations, the maintenance of that field is dangerous. That parking lot outside probably has better surfaces than that field because it's just used so much. So the maintenance, and I feel sorry because we get called, hey, the field's horrible. Yeah, but you don't give us a chance to fix it. You don't give us a chance to get them back in shape again for you guys, you know. So these fields that we identify is like that one that will be enclosed and monitored
Let
throughout
me
the
stop you
season.
real quick. Do other cities put turf? I mean, I know it's a very ideal, but I'm just, we're talking about, you know, we're struggling with, you know, for me, I'm looking at what can we do that would provide a return that's gonna tackle some of these longstanding issues.
Right.
And I'm struggling a little bit with turf.
Yeah.
Help me.
So to answer your question, Mayor Pro Tem, yes, they are going into more synthetic turf. Now I know nowadays the old turf used to be like carpet. Now there's actually blades of grass. One of the main things is water rationale. Is we don't have to worry about watering. The water is totally, you have to worry about watering right now, as you all know, with the water shortage that we have here. So that's a big help. But little by little, as you will see in other cities, they are slowly but surely converting into some type of synthetic fields. Again, I understand what you're saying, that not open to the fields. We're just going to be some select ones that are being most used. That, for example, Father Magnable, one of the baseball fields, the top one. That's one of we can artificially, because we can have a lot of games going on there. The three at Slaughter, those soccer fields, flag football, you name it, everything's going on in those fields. So we've identified most of the fields that will be closely guarded and be heavily used the most.
Okay, so Mayor, if I may?
Yes.
So if we didn't bond out for this now, we could always bond out for it in the future, you know, because I think we would need to get our surveillance up to date before we go and invest turf, because there's always going to be the risk of theft.
Always.
Right? Somebody could steal it and take it to their yard. Right? I mean, I'm just being realistic, because we do have vandalism issues where I just don't want to agree to something that we don't have the surveillance in place to monitor. We don't, you know, want to get the structural issues down before. So this is something we would consider and could potentially be a saving, but it's not necessarily something we have to go do right now.
Right. Yes, ma'am. So as you see, there our maintenance and operations for the administrative, for the synthetic turf, it'll only be no maintenance operation. The conversion to LED lights, I will go back to that, Mayor Pro Tem, what you're requesting, to see how much it would be the savings for it, because I'll give you a perfect example. Father Magnable soccer field, there's 96 bulbs in the soccer field. Replacing one is $1,200 just for one light bulb to replace. And those things are obsolete. You try to order them now, it's another $1,200. So we go to LED, those things, lesser lumens, what they call it, and more brightness, and they last longer. So eventually our goal is to convert all our fields to LED to get our money in return, so.
Mayor, if I may?
Yes.
But isn't it also cheaper? I mean, it's just from does the electricity bill come down? 'Cause
They put, for LED?
Yes.
Yes, ma'am, yes,
Okay,
yes.
so
no,
that's,
oh, yeah.
I would like to see those
Yes,
numbers.
yes, ma'am. And I don't have with me, but we've already done some kind of cost analysis. I know Liz, our park planner, has been working on that, and I will give you that information. But it's in the long run, it does make a big difference as far as just on the maintenance and fixing it. Surveillance cameras, like we said, we pay about $150,000 a year to keep up with the cameras. Right now, we installed 100. We want to install 100 every year to our parks. We're not doing the pool anymore. The trailing system will be a one-time hit. The rec centers, if normally it will cost about $307,000 to operate a year, each rec center. And then the water park, well, that's a separate item because I know that was removed. So here, basically, what you see here is the M&O for the items that were requested to the bond committee. And I want to thank also Mr. Arce and all our here that also helped us to listen and helped us to put this through the committee that was here.
Well, thank you, Mr. Gomez, and thank you for letting me know that Mr. Arce helped you on this. I was gonna say, do you have enough knowledge about LED lighting?
No, he was very influential on everything that I said.
I seriously doubt that you had that knowledge, because when you said it, I said, I don't believe that that guy's
You thought I was smart, huh?
He had Mr. Arce.
No, Mr. Arce was the main one that was our main.
Well, I mean, and so this is the deal for me on M&O and Parks and Recs. I know over the years, you and I have had great conversations about this, and in every city, it almost has to be automatic, that there's not a need for for green spaces and for people to gather. But for some reason or another, well, and maybe for a lot of reasons, that it's always a losing proposition for the city. Why? Because we don't invest enough money in personnel. We're always kind of behind the eight ball on putting too much money into something that doesn't create too much money, and we're always having to underfund and create more problems for you by making more parks and keep your budget at the same level or lower. And so it's been, I don't know why that dynamic happens, but it is true that the parks are sometimes, and I really think that a lot of people don't understand the value of our parks and recreational system, because a lot of people that are our age, I know you and I, through the years, we've taken advantage of every single park probably in town since we were kids, and up to the last, at my age, there's a lot of people that don't see the value in it because we just don't use them. I mean, I go for a walk, but I use the public streets for walking and do that. But there's a huge value and there's a huge expense in the upkeep in doing that. The only question that I have for you, though, is very difficult to understand. I agree with Councilwoman Sinaloa here, that the schematic is going to be very important. Go ahead and bring us something that you might want to think, where did you arrive at this figure to create administrative buildings? It's traditionally, when you go out for bond, most people don't like to pay for administrative buildings. They'll do it for everything else, but they don't like to do it for that. I don't know why that is. It's just a dynamic. That's just the history behind it. Right. But it's good to have the numbers and the figures right in front of us. The second part of it is that does this M&O that you have right here include, I know we're getting ready to open up the new baseball fields or the new recreation areas in the sport complex over there. That adds to your cost. That adds to the square footage of the M&O for the city of Laredo. One of the biggest items that a lot of people sometimes overlook is that for everything that you build, every single building that you put in order, every square inch, every square foot that you add to the city, it's more maintenance, right? And are we prepared to do that? So, in you adding these figures together right now, your maintenance and operation cost is going to go up because of that park over there. And I don't know what your MOU is with the ribbon cutting ceremony that we had this morning at Time of Youth. So those are incredible incredible. Those are big questions to answer in terms of just do we have it in the budget? Do we have it in the budget for every year to have the upkeep of these investments that we're putting out for the public? And so that question goes to you and to your team. I like the idea of LED lighting. It is expensive as it is right now. Those bulbs that you were talking about are incredibly and ridiculously expensive. But how do we get it to the level over the next 5 or 6 years to replace all of them and put it to LED lighting, where the light bill just alone on that is not gonna pay for that investment? So those are some of the things to consider.
Councilman, if I may interject, and I was going to about, so just an FYI, the Buena Vista operations and maintenance is paid through the sports venue tax. That is not part of our budget department and all that. That is paid through we're getting paid through general funding. That is through the Buena Vista.
I can understand and I can respect that, but it's just from one pocket to another, pretty much. And what I'm saying is that it creates also that, right? So, but there's cost involved, and then overall, we're looking at the overall picture of this. And I get it, believe me. But I'm just telling you that right now, I'm breaking down everything that you have in here. The priorities that are gonna come before me is the LED lighting, the LED lighting and the administrative building in that order, I mean backwards, right? And only because we can get an investment value off of that. I think people are gonna see that the rec centers, which I wish we could have more, I wanna have more. I just don't know if it fits into this area. I mean, into this particular, as Councilwoman Fierro was mentioning right now, into this particular package. I just see it coming down the road. I might not see it coming in right now. And only because of all the other things that we have circling around us. But I'd say to put a more detailed grouping of numbers and schematics in order for us to reconsider or to consider whether or not how we move forward to it. I like Dr. King's idea that we don't get it in May, we go in November and down the line. But I think that, again, there's a misconception of how it's funny out in the public that people see a quality of life issue, and then some people turn it around as an absolute cost, right? In other words, some people value it as an absolute quality of life issue, and some people see it as not a very important cost to remove it completely, and so they don't value that. So I think this is where we're gonna hit, where people are gonna butt heads in understanding. I personally believe Parks and Rec is an absolute valuable asset to the city. But I don't know that how people are gonna react to it when we tell them, let's put it into a 30-year bond. So those are some of the things to consider. Sir.
Yes, go ahead.
I agree with Councilman Garza as well. Having those, having 9 fields, then, having the Buena Vista coming up. We're promoting the Buena Vista, having those 10 fields coming up, but having new 9 fields with turf. Plus, I just can't see it. But what I do see is the surveillance, because I've seen, everything you worked hard, the people work, everything that, Parks works hard on, fixing restrooms, fixing, and then coming in and saying that all the damages, and so there's some damages that are pretty bad. Santa Fe Village, the Santa Fe Park, sometimes, you've seen those damages. But having surveillance, I think that's one of my main priorities, making sure that we have surveillance there. Another one would be the lighting. Of course, everybody talks about the lighting, having the new walking trails, which are in Slaughter Park, that we need those. We walk those areas that we need that lighting, especially because especially inside those walking trails, to have those lighting and to have the opportunity for people to do, because some people can get out later at night and it gets darker, but they have the opportunity to walk around, enjoy Mother Nature, just to relax or whatever. So it's, for me, the LED lights and the surveillance is one of the main things, and which is something I will see. But I do have a question, Mr. Gomez.
Yes, sir.
The Zacate Creek Trail System and the mountain bike trails in Shiloh, is it a contingency from yesterday's conversation, or is it from the grant that we had from the bike trails, or is it totally different?
No, this is totally different, council member. This is, this for the trail, this is something
I'm
separate.
just trying to
Yeah.
figure out if it's, you know, if it's the same trails.
Yeah, no, I know Councilman King, motion to put it into, is that correct, Doctor, to put it into, possibly into the bond discussion, but, if you consider, yeah, so, that's different.
That's different, okay.
Yes, sir.
All right. Other than that, thank you so much for
Yes, sir.
presenting this.
No, thank you all. So thank you all for your time, appreciate it, and, we're looking forward to it, all right? Thank you.
Mayor, I have just one question.
Yes, go ahead.
Mr. Gomez, do you think you could also, with the surveillance cameras, because I agree with my colleagues that it's incredibly important. I think the public will feel much safer when they're out there using the parks, and they do enjoy the parks. But if you could tie it to specific parks, let the public know where those cameras will be going in, and
Okay.
it'll be phased in over time, so they
Councilwoman,
have an
Mayor,
expectation.
Councilwoman, we have a plan, that we've met with PD, there's a committee. When we got the first batch of 100 cameras, we identified, and we went down to the parks that have the most vandalism and the most traffic. So we knocked out 100 of those, so if we go to this bond, we're gonna get 100, and we already know exactly where the next 100 will go, and so on for down the road, so that's the plan, ma'am. But we'll identify that already, like in other words, this is phase 1, this is phase 2, this is phase 3, where we go from there.
Mr. Gomez, I'm sorry, thank you, Mayor. Mr. Gomez, by any chance, do you have anything in plans just to have like at least security in the parks? Maybe, well, let's say from 6 to 8 or 6 until they close. And that way we can help, I don't know if you have something in plan, maybe it's on another story, right? But right now, this is what I'm seeing, that we having a security in those.
task force.
And like a task force, like a park police.
Right.
Just for them, not, so we won't intervene with PD.
Right.
You know, at least give them that space and doesn't, have to have 3 officers. I believe it's 3 officers within PD.
Right.
That takes care of all the parks.
Right.
Having at least level 3 security in that area, I don't know if you can, have something and some numbers for us.
Okay.
So see if you can bring it up
I'm
and
gonna-
see, and that's something, plus surveillance, the light, LED
Added
surveillance.
security.
And security, just so they can be patrolling the area.
Right.
Until the cutoff time, which is 11.
Right, so I'm gonna let Chief Rodriguez talk. I know we have a task force of Parks Police, and I'll let him, so you can kind of give you the numbers,
Good evening, Mayor, Council. So we've kicked this idea around for quite a while, and I think it's an excellent idea to bring the security personnel to the parks. The issue right now is to finding level 3 security guards and to put them under our command and be able to push them out to those areas that are most needed, right? So it's a conversation that needs to have, I guess, we need more time to explore it and to see how it would sit well with our organization and us, as well as with the city, right? Because definitely you would need a level 3 security guard to be in there. So yes, it's a conversation. Park Police right now, as you know, it's only 3. We're very low on resources when it comes to things like that, as well as Port Police. But we're definitely a conversation and of course a great idea that we can implement in the future.
All right.
One more thing from you.
Yes, go ahead.
I just wanted to mention, Mr. Holmes, and I agree with Councilman Rangel. I forgot to mention that in that order, surveillance is very important. I know you and I had started these talks about 3 or 4 years ago when we wanted to group with the ISDs and then put them, every park that's attached to an ISD, that we need to have an absolute way of surveilling those areas because, I mean, those are going to be the most critical areas that get some of the damage. But there's a lot of activity in there, so we can partner up on both those
Yes, sir.
ends.
I know.
Thank you.
Yes, sir.
All right.
All right.
Thank you. I'd like to take a 20-minute recess so we can stretch out a little bit. Second?
Second. Question for.
Oh, yes, ma'am. I'm sorry.
Go ahead before I take the recess.
I'm just trying, and please forgive me if there are so many packets here, but the presentation, the brief presentation from Tuesday's meeting, would we be able to see the main committee approve, like what they motioned and then what city administration recommended? Because the numbers are very different from the numbers
Basis.
we're seeing today.
That information is on the larger sheet, is that
But, well,
for what the council member's asking for?
Yes, I think it's here we have the difference between the administration and the current one. So there is,
Council member wants to see what the actual items are, from the.
yeah, we can see it here.
Okay.
I can go over them.
If we can get with her to make sure.
well, so the city administration for Parks and Recreation was 46 million. This is 80, so it's a big jump.
Yeah.
So I'd like to see. Okay, and then. That's what the rec centers were added. And then, but the pool and the bridge too? I think it would just be helpful for us to see what your recommendations are.
Yes, we'll make sure you got it.
All right? Yes, go ahead.
What number are we at right now?
And then
How much
there's-
are we at right now? You know, with that?
Right now, we're just going through the presentations. Once we finish with public safety, which is the remaining category that we have, police and fire, we'll be able to then take your recommendations as to what items you want to move forward.
You know, quick question, are we choosing today or?
Today?
Where?
We're not choosing today.
We don't know. February 10th. February the 10th?
February 10th
Okay.
and the 14th.
So we'll just have presentation.
We'll just have presentation today.
Just have that one left.
Okay.
February 10 is a date that we have as a deadline, so if we can come up with the items that in here, then bond council can then continue their work. If not, we're gonna have to have a meeting somewhere along the process to select whatever items we have in here. But, I mean, whatever council decides, as long as we meet those, the February 10th deadline.
So, okay.
I know next week is gonna be the Austin trip, so that week is out.
But right thing, right now, we have so much things that we're going through to make a decision right just tonight, so.
All right.
I'm just.
All right, go ahead.
So we can make a preliminary decision,
Yes.
right? Like kind of
Yeah,
where we're at. We have 2 more presentations before the end of the night, right?
Yes.
We're just taking a recess, we're gonna hear 2 more, and then we can kind of preliminary deliberate, finalize it by the 14th, but at least give you some idea of where we're headed, right?
Yes, ma'am.
All right.
All right.
Okay. 20-minute recess. Back to session. It is 9:09 p.m. Let's go ahead and continue with police.
Did you know? No, but I'm gonna die. I didn't have a no. Strategic plan.
All right, Chief. Evening.
Chief Miguel Rodriguez for the record. I know that there was an ask on the breakdown for our asks, right? And so here in front of you, you're gonna have what was presented to the committee. Of course, this was pretty much broken down into the needs of the department. Now, I know, like I said on Tuesday, right, that there's other needs for the city. And so when we were asked as to what the priority was for the police department, we ended up requesting our headquarters, which were in dire need, and our training facility, and we can go into depth into that. Now, as far as needs, and I want to share something with everyone here, as far as the needs of the department, there's greater needs that this community needs. And one example, and I think I've spoken with a couple of councilmen in regards to things like, for example, sexual survivor safe centers, right? So one of the things that we struggle with is when we have a sexual assault victim or a domestic assault victim, especially our sexual assault victims, we transport them to our local hospitals. And what we're doing there, we're just re-victimizing them again. They're sometimes waiting for 2 hours at the hospital to be able to get their SANE kit done. And so one of the things that we're pushing, and I've talked to Councilman Ricardo Rangel on this project, that so the 5.5 acres that we purchased for our South Sector Bureau, which is going to service our South Sector districts, that in itself, it was a 5.5 acre tract, and we ended up trying to compress that bureau, that sector, so that we can accommodate for a sexual assault survivor and domestic assault survivor safe center. And what that is, we're allocating those 1.5, and we had this conversation, Mayor, about being able to get these services to our community. And so when we're talking about needs, that's we're in dire need of that. The reason that is not in this referendum is because I don't think we can wait another 3 years if it doesn't pass to get that safe center going. I think that we need to take action now, and I know that I've explored the possibility of maybe getting state funds for that, and I think we are already conveyed this to Senator Zaffarini from the police department, that maybe we can get some funding through the state to get this operational. It is a dire need, not only because of that, but I'll give you some numbers just real quick as to what we're talking about here. But if you look at the numbers itself, this is how many victims we have a year when it comes to sexual assaults. You know, child sexual assaults, 269, adult sexual assaults, 234. And so when we're talking about this particular item, this is the amount of SIN exams that we do a year, 83. And out of those 83 that we can account for, 18 of these women were told that they needed to go home, not take a shower, and wait for that same kit to be performed the next day. And so these are the problems that we encounter when we don't have what is needed for our community, right? So this is just to give you a little bit of visibility as to what the needs are for Laredo Police and for your city. But the other issue that we also have as a need, and I know that you're probably going to advocate for this at the state level. I've been talking to Dr. Chamberlain on this and this as well, to be able to have a SANE nurse in-house. The other topic that we've been talking about as far as a need, it's also our mental health institution here. So a state hospital, we're in dire need for it. Why? Because right now, whenever we're going to be doing an emergency detention, we arrest the individual, or we detain the individual, we take him to the hospital. An officer sometimes has to rotate for a whole 2 days till that person gets diagnosed and transported to a state hospital. So our resources are depleted because we're also in dire need of a state hospital, right? So the conversation as to what the need is and what the needs of this community are very big. And so when we're talking about the police department itself, we need to take care of our infrastructure. And our infrastructure right now is pretty much very broken. And one of the things that you're going to see in our presentation is we did ask for all this. We already try to improvise on a lot of this as to how we can get them. The only thing that I can tell this council and mayor is that our headquarters and our training facility is something that we're going to put forth as a priority. And why? When we train an officer that's 21 years old, and we train him, I had this conversation with some of you where we're giving this officer has, is being trained to sometimes to de-escalate the use of force, to de-escalate the situation. And that's a lot of liability in our city when we're giving a 21-year-old the power to take liberty and to take life when it is right. So the training itself is crucial to our operations. It is crucial to remain up to the standards that is required by the state and above that. Why? Because we live in a border town. Every day we encounter different situations. And sometimes those situations are situations that puts us at a level of adrenaline that we need to make sure that our officers are always trained to be able to counter that. And so right now, we go down to where we're training, and I can show you that our training facilities, as you can see the pictures to your upper right and upper left, this is our briefing room, and this is where we train. And I know Councilman Gutierrez has seen this, and some of you councilmen have seen this firsthand. When we're training, you look at these pictures itself, we barely fit. And this is just a portion of our police department. When we're talking about concept, you know, we got pieces of land that we can say, okay, this is what we envision of constructing. You look to your left, that's an actual police station and a property room area for the future. And the way we're trying to put this in play is, if we want to build a police department that may be, and this is something that came out of the architects, is that, Chief, you don't have to build the whole thing to make it work, right? So we built what is the necessary items, property room, our 911 center, and things like that, our detectives division, to make sure that they do their work when they're asked to, right? So one of the things that we are looking for is that maybe we construct our building and maybe leave the second floor just shell. And whenever we have the funding to provide to go to the next phase, we do the finish out. And so that will save us some money. And so looking at everything that and when we're looking in the future, for the future, we're talking about reducing the amount of money that is going to be initially invested for our headquarters by doing things like that. So the number that we came up with was 110 million. And I know that some numbers are going to, some projects that are put forth here are $850 a square foot. We left it at $650 a square foot because we're taking this approach that we're not going to finish the entire building. There's going to be a part of the building that's going to be left shell so that we can build for the future and finish out for the future. So this approach, I think it's a manageable way of doing construction. And so this is what our ask is, that for the headquarters is $110 million. And that is to be able to accommodate for what it's needed. Priority number one in the headquarters, our 911 center. Our 911 center operations, we've already envisioned that we're put forth a plan that we're going to bring in our LISD and UISD centers there. And that is for us to have better communication with them. When we're responding to a threat to life to our schools, sometimes LISD gets a different call versus UISD versus Laredo PD. So all three of us are responding to the same thing, but different communication. So this is where the mix-up happens. The same thing happens with the sheriff's department. Sometimes we're responding to different things, and they don't even know what we're responding to. What if they're closer and they're there and they can respond a lot faster? Things like this that we can work on and we can get better is by creating these new and improved next century level type of 911 center operations. When something big happens around the city, and it doesn't only affect the city, it also affects the county, we have to have that communication. So what does our dispatchers do? They call county, they call the state. And to be able to have that communication and be able to deploy and relay that information to our officers, we don't have that right now. Now remember, in that 911 center, we also receive our fire department's calls. And so this is something that is very important to the department and very important to the fire department to make sure that we go and improve those spaces that we currently have. The other thing is our property room, right? Our property room, I can tell you that right now we pretty much are in the verge of being out of compliance. And some of you have seen our property room, and it's uncalled for, right? We're a 575 commission officer police department. We shouldn't be in that predicament. We should have the facilities that are needed to make sure that we service our 285,000 population. So that's another thing that is a priority when we're building this headquarters. To your right, do you have any questions on our as for the police headquarters?
Mayor, I do.
Yes, so let me just ask him a question. Does that include the land, this cost?
Yes.
Okay, all right. And do you have a site in mind or not yet?
We are looking at Saunders, Mayor, but right now, like I've told most of you, that it is wherever it's feasible for us to build. It can be, like I said, give me 2 blocks downtown to build up, we'll make it happen. You know, without anything that on any part of the city that we can save, except for, I'm gonna be very upfront, Union Royal is terrible. We would never be able to get out of there even if we wanted to. Mines Road, it's another one that we do have a warehouse port sector station here because there is a need in that environment to put one there. But to have a police headquarters there, you know, to get out of traffic, it's not feasible for us. So anywhere else in the city, we're up for it. We'll make it work.
Go ahead, Councilman.
Yeah, thank you, Chief, for this. The question I have for management real quick is, I understand that we're asking the public to support this, so, you know, approve the funding so that it gives us the flexibility to go out and start making this actually happen, but, is there a way to do this in combination with the Economic Development Department to make it, kind of like an economic driver and maybe get a donation or something like that from one of our, you know, we've got some landowners around town that are pretty favorable and friendly and have always looking to make Laredo better. I see in the diagram, you know, you're right along the frontage, but maybe we could work something out where you push it a little back and have some, you know, retail or some development in the frontage and make it kind of work to develop an area that, is that something that we could do, like leverage and to where we're estimating 110, but if we were able to work something out and save costs, we wouldn't have to bond out for the whole amount at the end when we actually put it all together?
I'd say Mayor and Mayor Pro Tem, City Council, yes, that could be looked at as a variable. You know, I mean, we can look at donations, we can look at sponsorships, all those different kinds of things. And with what you're talking about there about converting some of the property into a retail and finding somebody that would develop it, right, and utilize that for that. We can go through those things. I think what I would tell you, though, is that we generally cover the cost on the front end for most of that stuff, and then we seek reimbursements on different things. So keep that in your mind when we think about that. But we also have the ability, we don't accept the debt unless we take out the bond either. And so if you were to say, let's put it in this way, but let's look at those options that you're talking about there, we would have plenty of time to do that in order to get to that level. I don't think it affects anything that we're doing. And, but yes, ma'am, I think we could do something of that nature because we would have I think Dr. King said it most as well too, is that we have the authority to go out and borrow the money. But if we don't need it, then we won't. And so that would give an opportunity to have that conversation.
Thank
Any other question?
Mayor,
Go ahead.
when we're talking about priorities and the amount of money that you're asking for, Chief Rodriguez, it seems as if you've gone through kind of that exercise, that we've been presented here with an extensive list of needs, and you've taken careful consideration of that to prioritize where you think our really high priority needs are. And I was fortunate enough to tour the headquarters with Councilmember Garza and could see the real need in headquarters, the fact that our police department doesn't fit, essentially, yes. Right? And old technology and old facilities, but apart from that, it's not just something to make something look pretty, really, it's that the police department no longer fits in that facility, and it's not feasible nor practical to invest money there to expand it in that location. So I can appreciate the need for looking for outside land and also investing in the facility. The fact that you've also decided to phase this out, I think it makes a lot of sense. I know there was a small conversation about, there was some suggestion that perhaps the current headquarters were built that way, but it seems as if you did your research and under further consideration, that it doesn't allow for any expansion, not a practical expansion, even if it made sense, the land control-wise, right?
Correct.
So it seems as if you put a lot of thought into this, and I think the need is very high. I appreciate the fact that you're adding the SANE Center, and I have been approached by some people who have mentioned the fact that, you know, allowing women to go home and not be attended to immediately after an assault is almost criminal. And it's not an intention, it's just our limited resources. But if there's a way to resolve that issue, I think we absolutely should. So I hope that that will be included. I don't particularly see it here, but I hope that will be included in the final number. And I also want to thank you and your officers for the excellent work that you do with your mental health unit.
Thank you.
It is not fair that cities all over the country ask the police department to provide that mental health service to our community. And it's a failure of our society to figure out that piece and get it funded. And there's a lot of reasons for that. But the officers that you've trained have really stepped up. I've had personal interaction with them because of family. And they are highly professional, kind, and considerate. And I really, really appreciate the work that they do.
Thank you, Councilor.
So I am very happy to support what you've proposed here, the training facility, the headquarters, and the SANE unit, because I have seen the need. And thank you for looking comprehensively at our community and seeing how you can continue to serve in the best capacity that you can.
Thank you, Councilor. I appreciate it.
Go ahead, Councilman.
So, Chief, thank you so much for everything you've done for us, you know, the community and stuff. Right now, just my question to you is, where is it more likely that you're considering to locate the headquarters? There was talk about, you know, building in the south next to the complex. Now you said right now around Saunders area, you have an area more or less more definite that you want to, you know, and is the buying of the land included or not?
Yeah, so the ideal location for the police department as recommended, it's centralized, which would be the Saunders area. And what we had said about the south, looking at the south, is the training facility. So our training facility, if you look at the picture to your right, that's a 20-acre piece of land that we were looking at, and it's a 7,000 square foot piece of facility for all our trainees. In this 7,000 square feet, it also includes an indoor range. It also includes, and I know that Mayor, you got to see Virtua live with our city manager in Querétaro. This is exactly what you were practicing in at those facilities in Mexico. That simulator, it's a great training tool because of the fact that pretty much is a live version of what you might encounter. And so it puts the officer in that situation like if it was the real thing. So that's included in that estimate for the training facility. And those things are crucial for us to continue being trained the way we should as far as best practices and minimum standards.
Very good. Any other question?
Just one question. Thank you, Chief. I know we had that tour of the facility, and there's no doubt in my mind that there's an absolute need for a city this size to consider and to really put this project into motion. I'm just not sure about the phasing part. There's, I guess, two schools of thoughts on that. You either, if you do it now, you get the absolute cost of what you're gonna finance for 30 years. Correct. If you phase it again, the cost is gonna increase later on, 2 or 3 years from now, to do phase 2 or that kind of stuff. So that might be the only consideration that I would think of doing. I think you had a thorough explanation as to why the equipment is very important. We went through the scenarios, you and I, and it just makes all the sense in the world that, I mean, given the environment and the of the environment around here lately, and what you guys have to go through, what firefighters have to go through. It is a priority of mine that safety has to be first before we take care of anything else. So I'm in agreement with you on everything. I'm just kind of skeptical on the fact that we have to phase it out. I'd rather have everything done in one shot, put it in motion so that, you know, you're set for the next 30 years. But that's just my thinking. You might have run scenarios with somebody else doing it that way, so I'm not privy to that information. I'm just thinking out loud pretty much right now.
And we can definitely go back and put options with management, and then that way, whenever you're making this decision, whatever date you're gonna make the decision, you can either incorporate it or say, you know what, let's just go with option A, right? So we can definitely put both options for you. That way you can make the decision, and we'll go from there.
Okay, thank you.
Okay. All right, thank you, Chief.
Thank you. And just last thing, I was gonna, 315,150 calls for service is what we currently per year. Well, this is actually till October of last year that we had attended. I think we hit 378,000 calls per year. If you look at the 911 calls, abandoned calls, that means that the calls that we didn't get to, 14,707. This is the reason why there's a dire need for a 911 center operation renewal, because of these things that we cannot let this happen. So we've been getting a lot better because we've been tracking this and we've been putting more personnel. But at the end of the day, we need to make sure that we create the right environment for it. And the last thing I'm gonna say, I fully support, as your chief, our health department, and fully support our fire department. I've been there firsthand, and I've seen the horrible areas that they're working in, and some of you have already seen them. So as your chief, I fully support health and fire. Just put it out there.
All right.
Mayor,
Thank you.
Mayor, may I?
One, go ahead.
Just a last comment on the 911 center. So again, was able to see the 911 center, and if it's the size of a large hotel room, I think, you know, that's a big thing. You have so many people working dedicated. We saw the operations there, a lot of technology, fielding of calls, and I agree with you that there's a huge need to have people who they're dealing with very stressful situations, dealing sometimes with life and death. I really appreciate the fact that you're trying to incorporate the school districts so that there's better communication, because better communication leads to more efficiency, and in the end, that's better for everyone. And just that there is a need for that 911 center. Thank you.
Thank you, Councilman. So I'll itemize it and then send it back to management, and then we'll get it back to you.
All right.
Thank you.
Okay, thank you, Chief.
Mayor?
Yes.
Mayor?
Go ahead.
Just wanted to, before fire starts, throw something out there for the mayor and council's consideration for both departments. I was the liaison assigned to both departments to walk through their proposal. The equipment is very important as well, so PD's left out. Equipment and vehicles are very important. I think the public wants the fire trucks, the ambulances, the police cars to be available for them. So I know that the chief put two priorities forward, but as administration, we see the necessity of the other equipment as well for your consideration. So let's not limit the scope on PDs only for those two. I think we need to go bigger for the priorities. I think the public needs the response of the officers there. And the chief already advised us, management, that his request at the next budget cycle's a minimum of 85 cars. And that will just take out almost all of our CO money, period, just with that. And so just for your consideration, PD and fire, the equipment is very important for this. So.
Okay, thank you.
Look, Mayor.
Yes. Go ahead.
last time I had a question about that, and, if we added thank you, Mayor. Sorry, I had a question about if we added the vehicles and what happened if the bond referendum, let's say that the vehicles didn't, or let's say the referendum didn't pass, what would happen to the vehicles, or were we able to get more vehicles, or how are we gonna be, paid for those vehicles, or get vehicles for PD and for fire? So I get an explanation, but can we go into some more detail? I see Mr. Hinojosa, if you can give me an explanation of how.
Yeah, one of the things that Mr. Hinojosa's here, he is our financial advisor. Thank you for pointing that out.
Yes,
Mayor,
let's have Mr. Hinojosa come up here and give us that information.
So I'll be very brief. Record, Jay Waters, McCall, Parkers and Horton, bond counsel. I do the legal side, he does the finance side. So what I was mentioning last time is if the bond election were to fail for vehicles, there are other financial tools like tax notes instead of COs that you all can issue. So I'll defer to Mr. Hinojosa on any financial considerations that you all need to take into that, and whether or not that would be something feasible from his financial perspective.
Yeah, I think there are other tools to address, personal property needs. We can do contractual obligations, tax notes, and so on and so forth. Personally, over the last, I guess, several years that we've been here, personal property equipment, I'd rather not put in the referendum because that's something you need. And many cities run through vehicles either 3 years, 4 years, sometimes 7 years. If you have ladder fire trucks, those can last a little longer than the norm. So we try to put that apart. The concerns that I have about issuing or doing notes or something really short is that when you look at the overall debt of the city, it's like a water slide. So you have a lot of capacity to do a lot of things like personal property or other unexpected improvements that you may need from one day to the other and not impact the tax rate. So, when it comes to personal property, that doesn't have to be on the referendum. We can do that through many other ways, and that's my observation there. Is that okay with you, Jay? Okay, thank you.
All right, thank you.
Just one more thing, Chief.
Yes, go ahead.
On this referendum here, I'm seeing that it is added here as far as the fleet is concerned. Is that correct with the $176 million?
So we had added that, and that's where I was going, but when we did the numbers for the contingency, this is where we're gonna give you where the ask is, because we had added those cars, but Tuesday's conversation kind of changed the way we were gonna be doing this ask, because of the fact that we don't know if we should add them, and then we're not gonna be able to go out and do it.
But as it stands now, it's included in there at the 176.
So we're gonna remove that and add the contingency for the buildings, and then the same safe center that we're talking about, and it's gonna go lower, that number that you're looking at there. Correct?
But the vehicles are out.
The vehicles are out, yes.
Yeah, that's the problem.
The vehicles are out.
And that's a concern.
It certainly is, yeah.
Man,
Yes, go ahead, Mr.
Yes, go ahead.
Mr. Esparza, Mayor.
To clarify that, initially in the 176, like you mentioned, Councilman Gutierrez, the 176 included the cars, but now as the chief is proposing to make some changes there. But it is part of the 176 in front of you in the report.
Thank you.
All right, yeah, go ahead.
Mr. Neves, can you explain to us why is it a concern that we add those cars, or we can't fund those cars in the coming,
Mayor, City Council member, the concept of adding the cars was based upon what Mr. Juarez was talking about as our bond counsel as well too. If it fails in the bond referendum, we have alternative ways. It doesn't eliminate the ability to buy the cars. Our fear when we first started the conversation on Tuesday was that if the bond fails, then we can't go back for 3 years. And that's just only on the referendum itself. The idea about putting the vehicles in there and taking a chance on that is the number of vehicles that they need updated. It's a big number to bring them all up to date. They come up a lot quicker if they're in the bond referendum. We could petition them out over a couple of years where the debt doesn't come in all at one time and it comes in a period of time. So the thought process on that, and going back off of what our bond counsel was saying, is that if it was to fail within the bond referendum, we still can get the vehicles through exactly what Mr. Hinojosa is saying, is that there are other methods. So it really becomes a consideration for you as the elected official as to whether or not you want to add those items into the structure of what the chief is trying to do with the police department, or if you think that we just want to go to the option B, option C as to how to get that done. We just know that their vehicles wear out very quickly. Within 5 years, we need to get, we have a number of them that are in, well, I'm just going to say questionable shape. I think they do a great job with their equipment, but they use them. And so that's the only reason I think we're putting it out there saying. Yeah, go ahead.
The only thing I don't see is going out for a referendum, asking for so much amount of money, then having the life expectancy of this car for 2 years, 3 years, and that's saying that you won't have an accident or,
yes, sir,
God forbid, an accident or chase that we have often here in Laredo. That's something that we got to consider as well.
Yeah, and Councilmember, and that is part of that whole strategy of looking through exactly where it is, right? Because the vehicles they have a 5-year life expectancy within the police department. But then I would go back to what Councilmember King had said as well too, about when you look at San Antonio structure, they're going out every 5 years. We could establish a vehicle bond question, you know, and it doesn't have to cloud up everything that we're doing. We can establish that. There's a lot of good lessons out of San Antonio for that. They got a facilities bond. They've got they do their structure a little bit differently. So we're moving that way.
Mayor, if I may.
Yes, go ahead.
I was gonna mention that, you know, I know Chief Landine just talked about, you know, asking for things and the needs, but I think the conversation can't come from the standpoint that this is gonna be an automatic yes. We still have to have, and I think that's where we're all coming from, is like, I think this is a good vision, like a good kind of like exercise for in like where we are representing we're looking at it from what can the people afford versus management coming to us with what the city needs and trying to find that balance. And so this is kind of like what we're tasked with. It would be nice to say yes to it all, but realistically we know that this is going to be a tough sell as requested. So I don't think I don't think we could realistically look at this from the standpoint of, well, it's going to pass, so let's just ask for everything. Correct. I think we need to start thinking about what can we do without now. And for example, the public work, the paving presentation, it was broken down out by 4 years. If we have the capacity to bond out every 3 years, then why are we talking now about something that's budgeted out for 4 years? Why not just talk about what we can do in the next 3 years before we can come back and ask for the rest for the following? I think there's a disconnect between the ask and when it's going to come into play versus, because right now it's going to be a big lump, right? So I know that police has a big need. You know, we're talking about building these buildings that have gone, out, like pushed out a long time, and we want to help, and we want to help make it happen, but we don't want to put so many things in there that the public says we can't. We would be okay with, let's say, an extra $10, $20 a month, but we're not okay with an extra $100 a month. And that's kind of where we're at here, right? So if this is something that we can, get some of these things now, and then the public starts to see that we've made these improvements in terms of better response time, better efficiency, more services, then in 3 years when we come back, I don't think they would have an issue granting us another, chunk so that we can continue progressing. So that's where I feel like, we want to throw in whatever we can and ask for what we can, but we want it to be successful and we want it to pass.
Yes, go ahead, Councilman.
I just, with Mayor, and just along the same lines, I don't think enough emphasis or consideration is being taken, is being taken, with what Mr. Hinojosa said, like, we need to, and even us being advised, like, if our bond council is saying let's not throw in all of the items that are gonna last 5 to 10 years, because our people are gonna carry that for 30. That,
Mayor?
there needs to be
Yes,
more
go ahead.
consideration.
I agree with Councilman Sierra and Councilman Perez, doing this, we have the bond council here, and they're advising us, we've never seen it, we don't recommend to do that. Right now, it's like, okay, we need these vehicles, but like Councilman Perez said, we can do it the first 3 years, next 3 years, let's say we go out for this bond, our one is to a minimum, and we start showing, we got better surveillance, response time, along the things that Ms. Perez said, then we can go out and go out for a bigger chunk of money and say, you know what, this is what we done. We can go, we have proof, and show the community and say, hey, we have all this, we've done all this, but we need your support, we need your help, and so we can go out and get more money. So, that's why I gotta agree and say that we do have the bond council to tell us, to recommend their options.
And Mayor and City Council, know that as I've talked with all our departments and everything, anything that you do to help support any of this helps us all do our jobs better. I mean, we're where we're at today for that. I guess when I think about the vehicles, it's the same thing with the vests that they wear, the tasers that they have to carry and everything. A vehicle is something that they are in 24/7, essentially. And that's the only reason. But I agree with exactly what you're saying, is that we want to make sure, because you have to prioritize out what we need. We can't absorb it all at one time. We can't make up the difference for our growing community all in 1 year or one cycle. The whole challenge, though, is that, and the only thing I wanted to make sure as you strategize as to how we do this, we want to watch out for voter fatigue as well, too. We don't want to put things out there too often where the voters are saying, we're back again, right? We're back again. And so I think that's the one thing you want to be careful.
Let me just clarify, just say something about that. Voters, but particularly me and myself, and I don't know about some of my colleagues, and I imagine they do. They get calls, recommending things often, saying, hey, we need this.
Yes, sir.
Hey, why do you guys don't do this? And this, so I think going out to them and give them the option or getting them involved, I think that's something they're trying to figure out. So going out for referendums, sometimes it's the best things we should do for the community, right? Going back to the vehicles, maybe we won't have the budget that we need, the budget that we need, but we are gonna have, in case that we do need the vehicles, we gotta get them regardless, because we gotta have our safety, public safety out there, surveilling and, protecting and patrolling the roads. So even though we don't have the budget, we gotta find the budget for that, so. That's
I just wanted to make sure I laid that out there and.
Well, Mayor,
Yes, go ahead.
just like with the Hamilton, is there any way, Mr. Neb and, Noe, that we could, maybe put together, if we were to leave out the vehicles from the referendum, but we were gonna finance them with this method and maybe sell a bond just for that? Or, I mean, if you're saying there's other vehicles for the vehicles, yeah. So, if there's other options, then maybe we can.
Here's the risk. You gotta run public safety. Whether you pass a referendum, whether you call a referendum, or you don't call a referendum, you gotta run public safety. If you put these initiatives in the referendum and specifically says, I need this equipment, and it fails, how are you gonna run that? Because you can't use any other funding tools for the purpose that you said that you wanted to have the bond referendum approved. So we're kind of hedging, right? Now, outside of the bond referendum, your mortgage payments look like this. So when I tell you it's a water slide, you keep revenues at the same level, the yellow line, So anytime that the bond payment drops, think about you having a mortgage or two or three. And as you're paying off those mortgages, then you pay less money because now you got rid of one mortgage. Well, outside of the bond referendum, we have a very formidable, very friendly annual payment structure. It looks like that. Your revenues are here. Well, if you keep the revenues constant, which you will by virtue of keeping the tax rate, then you fill in the capacity. When you asked me, Councilman King, what capacity we had, and I said to you 30. I think we borrowed like 35 or 36, something to that effect. Because interest rates fluctuate, as I'm making representations to you, I'm also mindful of the fact that property values increase. We just don't know at what rate. But what we do know is that if you can preserve your income stream, as you do, as you have, and you're paying off these mortgages very quickly, then that gives capacity not only for equipment, but other needs that he is going to need that right now we cannot tell you. What we have before you is a 5-year capital plan that needs to be bonded for. If you're saying, oh my goodness, this is too big of a number, if you decide to go with something smaller, that's your prerogative as a council. You can do whatever you want to do. We need guidance from you. The task given to us was within your prowess or whatever information you may have, work with the committee, tell us what you need for the next 5 years. And that's the number, 540, something to that effect, right? More or less, or más o menos. So basically, now you got to tell us, okay, do we call that 540? Do we call something less? Can we live with something less? What we want from you is give us the ability to have more tax revenue streams so we can do more. I was comparing Laredo to other cities in Texas. Laredo, I think, is like the 12th largest in the state, among the top 25 cities. And only McAllen has less debt than you in terms of property tax supported debt. I was looking at the numbers. You got like $350 million of property tax supported debt, but 150 is paid by our children. You know, those landfills and solid waste and so on and so forth. So we got this water and sewer pays off property tax supported debt. So what impacts the property tax rate is about 200 million. Every other city in Texas has more debt than you do. So we're very well managing that debt. So if you pass no bond referendums, we go back to what's the capacity? The Band-Aid approach, as I've always called it. You know, you had Mr. Orfila come before you. He's spending $4 or $5 million a year for streets. Can you do a little bit more? It's up to you. What we try to do on our side is provide you with a nimble debt structure. But if you tell us we want to call a bond referendum, we want to be transparent, then if you're doing that, then you got to tell the taxpayer, but if I do this, it's going to cost 3 cents, 5 cents, a dime, whatever. If you look at the tax rate, among the top 25 cities, I think the city of Laredo is like number 8 in the lowest tax rates in the state. I mean, among the top 25 cities, not every city in the state. So what does that mean? What that means is that you're in a very, we do something like this, and I can provide this to staff so they can forward it to you. But what I want you to, when you say, how do I compete against others, you are in a position to where you can compete against it. You have a very, very stable rating, very stable rate. Your rate right now, correct me if I'm wrong, is 50.76, 51 cents. So as a total tax rate, you're number 10 in the state. So if you call the bond election, and let's say the impact is 5 or 10 cents, then I'll take a look at what would happen where would the city's ranking be if you go higher, let's say by 10 cents. You'd be number 13 in the state, and you're the 12th largest. So it's not like you're going to be an outlier. So the rating agencies are not going to go, oh my God, what are y'all doing? No, and I've been monitoring this stuff for 20 years now, so that when we come before you, I have a peace of mind that we're going to preserve the rating. And like anything, we represent bigger cities like San Antonio and Dallas. Dallas lost the AAA rating many years ago because Moody's felt like you're not doing enough. I mean, you got a low tax rate, you're being very conservative, but you're not doing enough to remain attractive for investment to come in, for businesses to come in. So guess what happened? Dallas had to call bond elections, after bond elections. So we just did, I think, $1.4 billion last fall for them. And those are the kind of things that take a long time to kind of rebuild. So what we're trying to find from you, and I don't know, Mr. Neves, is appropriate, is just a little guidance. I'm actually, I was telling him by text that I'm actually very impressed that you guys have been very respectful to each other and reasonable, and even to staff. I'm glad I'm standing next to the chief. But I just feel like if you give us support for whatever you think is proper, because you're gonna have to be the ones carrying the flag for all of us. And what we want you to do is be successful. We want you to pass it so that we can all celebrate. But whatever you decide, I want to tell you that I won't be shy. I'll come up here and tell you, what are y'all doing? You're going to be getting out of the box. And we don't want you to get out of the box. And whatever you decide, if you want to put equipment, I do believe that equipment can be funded separate and apart. Would it take capacity from other CEOs or whatever? It probably will, but I mean, this bond referendum is very, very fun. It's very important for you to become maybe more credible out there too, because we want to be credible, right? So.
All right, thank
Mayor,
you.
if I may close out what I was trying to state to the council, just for clarification. We want to put it out there that the asks from both chiefs are very large for vehicles in the coming budget. And because of that, the capacity for the other projects that you have in mind for your districts may not be there. And so to be transparent with you all on that sense, but we're recommending a combination of this bond for the buildings and stuff like the chief is presenting, the fire chief. And, but there also is a heavy need for those vehicles, especially for the police department that has 85 minimum next year, and that's going to affect the bigger picture of all the CO money.
Go ahead.
I have a quick question, and bear with me while I ask, or help me ask this question. But, so by attempting to transfer some costs from an immediate absorption, so by attempting to transfer costs from general fund or the obligation, the bonds, to a 30-year bond, so we can have room for projects next year, how much is that ultimately going to cost the payer? Like, I want, what is that number?
So let me tell you
what are we actually saving, or is it's in the long run, it's going to cost us more?
Those are great questions, but you're combining something that lasts 3 years with something that may last 20, 30 years if you put the healthcare facility or the parks.
No, but yes, I mean like the things that are
That are short.
They're short, and we're funding that with a 30-year bond.
Yeah, so the lender looks at this big package, kind of like when you buy a house. You gotta furnish it, right? Sometimes you get a mortgage that includes furniture, and the lender says the first 3 years or 5 years is gonna be for the personal property. The 6th and beyond is for the brick and mortar. That's what a rating agency, that's how we see it. When we do COs for you, we put equipment in there. And sometimes I accelerate the payment of the COs on the front end to justify, because we're doing more equipment than we're doing brick and mortar. When we do these GOs, if you get the fortune of the support of the public, we will do a 30-year financing or 25 years, whatever we think is practical. And if we have a lot of equipment in there, we accelerate the bond payment. In fact, so you know, if you get approval for $500 million and you give us a dime of a tax rate, I want to raise, well, I want to make my life easier. May not be easier for you, but we raise 10 cents immediately so that you can pay that debt very quickly, because very likely 3 years from now or 5 years from now, you're going to need to come up with another referendum. And what we would like to do, what we always do with our clients, is structure payoff quickly so that you can do more capital improvements and you become more credible with the voters and earning their trust. So going back to voter fatigue or election after election, you have one shot at earning their trust, and that's the very first time. And fortunately or unfortunately, the public today looks at everything. And going back to your equipment, don't get too blinded by the 3-year car or the 5-year car being financed over 30, because we're not financing just a car. We're gonna put one package, one bond issue for $100 million that happens to have 8 or 9 for equipment. You, in your mind, you see it over 30 years. In our minds, the rating agencies, which give you a AA credit, they don't see it like that. They see the first payments, just think about it. The principal payments occur in year 1 through year 7. And very likely, that'll be more than $9 million on the front end. And then the rest of it, the other 91 million, go for brick and mortar, which goes all the way to 30th year. So don't, because you're doing a one master loan. Although, if I was doing a lease, then I would do the lease, or a public property finance contractual obligation, I would do it within 10 years or 8 years. But if I do a CL that complements the lease or complements the PPFCL, I will wrap the CL around this payment. Because what I want you to do is stay practical in case issues come up that you may not see from one year to the next. So don't feel too bad about it, because every city does it. And you gotta survive in the good times and in the bad times. I hope I helped. I don't know if I know you may have a fundamental, issue with it, but when it comes to finance, think about it like this too. You buy a house, you have the option of paying a 30-year mortgage or a 15-year mortgage.
But you don't take out would you take out a 30-year mortgage on a house that's gonna collapse in 15?
Yes, if I can take my kids to eat. You know what, if I could get a loan for 30 years on a house that may collapse in 15, I still have to take my kids out to eat. I still have to clothe them. I still have to pay for tuition or travel. Maybe that's quality of life. Because this city, one of the things that sometimes we get lost, this city is going to survive you. Certainly it's going to survive me, right? But it's going to survive all of us. This city has to be open for business 24/7. These people here have to work 24/7. And the taxpayer, he works 40 hours. This city doesn't. So we have to stay practical, nimble, in case something comes up, like a water line breaking. One of the concerns that I have right now is building the savings account in the general fund. So we'll talk about that later, but to me, don't be too hard on yourselves, because you've done a good job with the finances, the debt finances of the city. You're in a good position to do great things. But anyway.
So Mayor, what he's recommending is a combination, which is basically what we're saying.
Yes, okay.
Mayor, just real quick, I forgot to thank Mr. Chuy Olivares. He is our chairman for the committee. I think Rick is here, and somebody else, Olivares is here. So just thanking them for their work and their effort. I mean, they pretty much put a lot of meetings in play and pretty much went into depth into our public safety committee. So I really want to thank you for being here today.
All right, thank you, Chief, and thank you for them. Chief Hurd. Oh, I see Chief Hurd.
Last one.
Sorry, Mayor, may I make a comment? This is a special meeting, and special meetings have to end by 10:30, just so you know. You cannot extend until 11.
All right.
I was gonna do a 45-minute presentation.
So go ahead, Chief.
No, I'll give you the condensed version of all the asks that the fire department does. I know they say we're an 80 department, and we are. Guillermo Hurd, Fire Chief, Emergency Management Coordinator, City of Laredo. Thank you, Mayor, Council, Management, for having us present our 5-year plan to you all for the needs that we have for the fire department in order to continue serving this great city here. Some of these things are repeated, so I'm just going to go to the main parts that are related to the asks that we're going to be doing. So one of the big things here that what we're asking is, what we're asking in our bond referendum are specifically facilities, equipment, and vehicles. And I gave you a presentation there where it shows the studies too, specifically related to the request that we're doing is, but one of the things that I have here in my presentation is that the last time that we added a fire station, which is the Celito Lindo Fire Station, was in 2003. That's over 20 years ago. Since then, the city has annexed over 30 square miles. So at that time, the city was about 89 square miles, and then since that, we've annexed about 30 square miles. We have relocated and we've had remodeled stations, but we haven't really added to the amount of stations to the city that has had. So the city, as we all know, as Mayor, you say in presentations, is the fastest, if not the fastest growing city, and this is the largest land port in the Western Hemisphere. We have a lot of needs. It's growing rapidly. At the same time, emergency service, fire, and police at the same time too. And it is a challenge there. We've seen, it's been a challenge for us to respond quickly to the calls, but we do. Traffic is a concern too, and inside the city too, is one of the things that I was asked as a fire chief is, why would a citizen inside the city care that we're building, that we have needs outside the city? And it's because it directly impacts them too. Because right now, in order for us to respond to the outer parts of the city, we have interstations that respond on the outside. So essentially, you take from Peter to Pay Paul. So our outlier areas where we need the fire stations is the cities inside are they're the ones covering. And then there, when there's a call in that area, another station has to supplement too. So it's a very challenging thing for us to continue responding within the recommended response time that we're supposed to have for every emergency call: fires, medical calls, hazmat, and rescue training and rescues. We hired a consultant that was recommended by some of the other cities, some of my colleagues. He came down, professional engineer, and he did a master station location study, and then he identified, which we were aware of some of the needs that we had, that we were short 3 fire stations. 1 fire station in South Laredo, 1 fire station by mile marker 1315, and another fire station that is supposed to be there by Mines Road and the Green Ranch area. And then he also identified that we needed a fire truck to respond by the 59 and Loop 20 area. There to respond, we have a station at the TAMIU area and then 1 by the SAC, but there is a gap there that is recommended that we have a fire station. He also identified that we needed to move our ladder trucks. Our ladder trucks are our big fire trucks, the ones that have the ladder on top. Although we might not have many skyscrapers here in the city or large, tall buildings, but we do need a lot of large volume of water for warehouses, big structure fires, and that's what specifically those ladder trucks provide. So those ladder trucks were recommended to get moved from the Celito Lindo area to the Cigarroa station, and then from the Sam's station to the Mines Road area. When we did that too, while we were responding more efficiently, we increased the number of firefighters at those stations. Those stations were not built for that many firefighters, so we increased the capacity. Now my firefighters are there, they're ready, do not complain, but we've identified here an opportunity to remodel and modernize those stations for our firefighters. We also did another feasibility study that was done during when Chief Landin was our fire chief, that the station that's at the airport in front of the main PD headquarters is supposed to be moved a little bit further to the McPherson-Calton area in order to provide services for that area. Right now we have that fire station right there beside the airport, which, as the airport director says, that it's in prime real estate property, that he would like for us to vacate that area. But I would like to vacate that area too. But that's another area that we identified that we need to relocate that fire station. So currently, part of our strategic plan is, and in the last budget cycle since I've been here, Council, Mayor, you've been very supportive. We started the process of building the South Station, the North Station, and we've relocated those fire trucks, those ladder trucks too. Here's a quick overview of our response area. On the right-hand side is a map. All the little red houses are where our fire stations are. And on the left-hand side is our cities broken up into 3 districts, 3 emergency districts: South, Middle, and North. Each district has an incident commander, which is a chief. when there's a major call, there's a certain incident command system that works. When we have a major incident, usually a fire, there is so many fire trucks and ambulance that go, you have so many captains. You need, in each area, you need to have an incident commander, which is, as we know him, is a white shirt. So there's a certain incident command system. So the city's broken up into 3 different areas too. This shows a quick overview of the areas that we need the new fire stations too. So one by mile marker 15, one by the Mines Road Green Ranch area, and one by the Buena Vista area, and the fire truck 2 that is there by Loop 20, that's where we need a fire truck also to respond. So the importance of ISO designation. So it's something that I've had the opportunity to talk to you about. It basically says how efficient we are at conserving property. The 2 main missions that we have in the fire department are save lives and conserve property. So the ISO rating says how efficient we are at doing that, at conserving property. We are, fortunately, through the support of mayor, council, management, we recently got that ISO designation of 1. There's only a small percentage of fire departments in the United States that have that ISO designation. I've been told by our consultant, and talking to other fire chiefs, and I've seen also headings from mayors and city managers that say that big companies, when they relocate, they look at 3 major things: quality of life for their employees, tax abatement, and ISO ratings. The fire marshal is here, he can attest to say that they do get frequent phone calls that say, what is your ISO rating? ISO rating directly impacts the insurance of the businesses and the residents too at the same time. One of the big asks that we're asking for is the facility improvement, new fire stations, and also the remodeling and relocation of some of our fire stations. We did an assessment study of our stations. 50% of our fire stations are over 50 years old. I've been told before about our fire stations is that we hired a specific architect for our fire stations because they're not offices, they're homes for our firefighters. 24 hours on and 48 hours off. That's what a firefighter's schedule is. 1/3 of their career, they spent it at a fire station. So that's where they live, where they eat, that's where they wait for the calls. Studies show specifically the way that a fire station is designed directly impacts the life of a firefighter. When I had the opportunity to give the presentation to the bond committee, I was going over the life expectancy of our firefighters, and I mentioned to one of our, and I had the opportunity to mention it, and I said the national life expectancy of a firefighter is 62 years old. And then I think one of the bond committee members heard me correctly, and she thought that was the retirement age. No, I said that's the life expectancy of a firefighter. You know, there has been great advances in firefighting and the gear that we wear, but I know so many firefighters that they retire, and Chief Landin can attest to this, is they retire and a couple of years later, they pass away. You know, it is inherently a very, very tough job. The chemicals that we are exposed to, the sleep deprivation. So the stations that we're asking to remodel, we're asking to modernize them. Certain things that we can do at certain stations can reduce that. As a chief, I always tell my young firefighters, start taking care of yourselves now. I want you to enjoy your retirement as you deserve to. And there are certain things that we can do at certain fire stations that we can modernize them that can decrease cancer risks. You know, also sleep deprivation leads to PTSD and anxiety too. A person that has PTSD, anxiety is more prone for cancer too. The new fire stations and the new ones that we're getting to design, like the one at your district, Councilman Gonzalez, there's going to be a certain, there's going to be like a decontamination area, a whole cold, a warm, and a hot zone. And that's why I wanted to get the opportunity to design the new fire stations too. So that is why I put in the bond proposal to remodel some of the fire stations, phase them in. You know, a couple of years ago, we were able to modernize a couple of the fire stations when Chief Landin was the fire chief, and right now I'm taking the opportunity to modernize some of the other fire stations too. These are the main priorities that that I put initially from the bond committee. I know from the presentation that the budget director have, there has been some changes, but this have been the main priorities that I have put is the new stations is 3 new stations. One in South Laredo, Buena Vista, mile marker 15, and the mines in the Green Ranch area. Remodeling is the fire shop that we have, the station by Mines Road, the station by Cigarroa, the station that's over there by Pinto Valle, our training field, the station that's by Bartlett, the station that's by Houston, right down the street, and our fire administration building. And I put those in the order of priority. Relocation also of the station that's by Maher, that's the one that's by the airport, and the station number 3, which is the one here by Martin. That station's been active since 1939. And on the other side, I have what we need for those stations: land acquisition, the design, the vehicles needed for those fire stations, the equipment, portable gear, portable radio, 911 antenna. We've also updated our active shooter responses. Now studies show, and we're working diligently with LPD, is we've moved, now when we respond, we don't wait on the outside of incidents like of a school. Let's say, that's the world we live in now. We've trained our firefighters now that we actually go inside. We don't carry weapons unless you're an arson investigator, but the PD will create a warm zone for us where we can treat patients quicker. But with that, I also need to equip my firefighters with the right equipment: ballistic vest, ballistic helmet. So that's also something that I'm making a request here. They're very expensive too, and in order to equip all my fire trucks and my ambulances, that's why I put that here too. Storage containers specifically for training, breathing apparatus, units, and technical rescue equipment. Here's a breakdown of my ask. I was asked to prioritize them by priorities, and this is how I prioritize them by year. I have more detail there for you in your slides. I also put my studies there specifically on why I'm asking for what specifically I'm asking for. And other than that, I can go more specific into the presentation, or I can stand by.
Mayor, can I ask him?
Yes, go ahead.
Chief, I know that you and I hadn't a chance to sit down. I think your presentation was, and I read through most of it already. Obviously, it's elaborate. But I think Mr. Hinojosa threw us for a loop right now. You know, obviously now that it's said that go ahead and throw equipment in there. It raises a new level of not concern for me, but of thinking, right? I think everything that you say is right. I think the idea that mental health to not only our police department and to our firefighters is at the top of my list, that we take care of them first and you guys first. If you're considering to put these quiet rooms and to have these decompression rooms and all that kind of stuff in there, I am all in on that, because that's the new way of thinking, and that's thinking outside the box that gives longevity to our people. And we have to take care of our people first. So I commend you for that. I think the numbers speak for themselves. I just don't know where on Calton and McPherson you were thinking of putting it. I was thinking, though, now that you said that Y Street that's there, I don't know if that's airport property. I don't want to have anything to do with those people.
It's not. We've sent a letter of interest. I asked management. I won't get too specific because it's just a letter of interest.
Yeah.
But for the different stations that we've asked to remodel and relocate, there is specific areas that we have in mind. Letters of interest has been sent already. I've worked with the real estate department under community development, and we have an approximation of the cost on there too. But we do have an idea where we would want those stations. And you're correct. That is one of the areas that we are considering. That would be a prime location and would fit a fire station there. The fire station that I would see there is like the size, like the one in front of Tammy U.
Yes.
That's the type of fire station I would need. 2 bays there. I think would be a fire truck and an ambulance would serve your area very well, council member too. But we've already started with the permission of management, of course, of reaching out and just interest, because of course it's all dependent on this, and I do have the approximation of what I think reasonably working with real estate what the price would be. And going back to what you're mentioning about the wellness and the mental health, with that, it shows now that the specific lighting or the way that our firefighters are awakened really impacts our firefighters too. So I know one of the things here, we've done a lot for mental health, you know, and right now we're actually doing a mental health training at our fire department. I know we had the opportunity, council approved of us, we hired our own psychologist, and actually she's here. Dr. Blanco is here, and she wanted to come see the presentation. But she is guiding our firefighters. She is guiding me on certain things that what would help on best practices and help reduce the stress on our firefighters too. So first and foremost, like Mr. Nebha says, we need to take care of the people that take care of everybody else too. So well, I'll stop on there so because I can keep
Well, it's
talking.
just that I was going to tell you that I agree with you on that. I think we'd be incredibly irresponsible if we don't start thinking outside the box. And I know we're trying to do it. I'm prolonging. I'm doing this. Yeah. No, it'd be irresponsible of us for us to not even consider those type of things in this day and age. That all the data is out there, and we don't think like that, and we have that old school thinking and some of the ways to tough it out. We're not giving longevity to our people, so that was just my point. Thank you.
Mayor, what I'm hoping to do in just the last few minutes, thank you so much
Thank you,
for all
Chief.
your time and everything, but what I wanted to do is have Mr. Juarez come up. This is the draft document. This ordinance will be the draft document that has the questions for the election. So I want him to explain the body of this, and then Mr. Mata and Mr. Esparza is going to cover how we're going to help you walk through all of this information. Because what we're gonna do, I believe we're gonna send you the spreadsheet and let you go through, you'll have all the stuff and you'll be able to adjust it. And then I will recommend that we come back on the February 10th, the Monday, to finalize this information. And if we can get it all done on that day, then that's fine. If not, we have to have it done by February 14th. We'll just put in an extra blessing meeting for whatever that information is. And so,
Mayor?
Yes, go ahead.
Can I request that we be polled for the 10th versus the 11th, just for?
yes, ma'am. Yes, ma'am. Yeah, I'm happy to.
Yes.
I'll help with that.
Go ahead.
So, Ms. Juarez?
Thank you, Mr. Neff. Your meetings have to end at 10:30?
Yes.
I'll be very quick. The election ordinance, I think the most important paragraphs I want to draw your eye to are the measures. You have measures A, B, C, D, E, and F. Those are for each category of projects that we have been presented today. What we need finalized before you all meet to call the election is the measure language, the amount, and the proposition language. The measure is what's legally binding. The proposition is what's on the ballot. The proposition is very short form. I know Councilwoman Cigarroa talked about wanting all the roads in front of the voters, so that would be in the proposition. That's how the City of Corpus Christi does it. City of San Antonio has them in the measure so that the ballot isn't so long. That's that. Happy to answer any questions.
I think it presents a lot of reading opportunity for the voter. I'm sorry, go ahead. Anybody else was on?
No, go ahead. Go ahead.
Well, I'm at green over here.
No, go ahead.
Okay, well, anyway. Okay, there it is. It presents a lot of reading opportunity for the voter. I'm not sure that, it's sort of like they're gonna see the blank space and they're gonna see the number without reading it through. I don't know if it can be simplified a little bit more, because I just see the paragraph and then the.
So if you look at the proposition, which is the second one, so the measures are actually, it's what's legally binding, they're a lot longer, but if you go further down, there are several propositions, those are very short phrases, and that's what's gonna be on the ballot that the voter.
Oh, the ballot, that's not, these first ones are not gonna be on the ballot, these are the ones. Yeah,
Right.
okay. Okay.
Mayor,
Yes, go ahead.
do we have the possibility to, put out that and then have more explanations, more language that explains?
We can. That is at the discretion of council, yes, ma'am.
Yes, go ahead.
Mr. Esparza, can you put back up the slide of the economic impact to the taxpayer real quick, just so we can, you have it in there at the current requested rate, and then I'd like to see what it would look like at the $300 million rate, $350 million rate.
This slide shows the 400 million and 500 million have in here.
Yes.
So what we're gonna do is we're gonna email this spreadsheet, we're gonna log some of the fields, and this is the summary page, summary CM. The summary page brings everything from the individual page. So when you look at the individual pages, this blue, which says council, is where you can drop in a number that you have in mind. And then what that's gonna do, it's gonna populate this summary page here. And as you scroll down, it'll show you the total amount that we have for the financing here. And then it'll give you the breakdown of the cents and the impact on the $200,000 home.
Okay,
Mayor,
thank you.
Yes, go ahead.
So we had some, Mr. Nev, we had some I had some specific requests from the Parks Department to have more information about what their proposals would be. Is there a way to get that done and then email it out to us?
Yeah, Mayor and City Council, what we'll do is we'll take all the questions that need to be spelled out a little bit farther. We'll do that, because I think we can do that same thing with the streets as well too, so you have an idea of where we're focused on. We'll do the same thing with Parks and Recreation and any of the other things. What we're gonna do is we'll get you the spreadsheet information in a spreadsheet format so that you can kind of go through and highlight the ones that you believe are the most highest priority. And then we'll pull the other ones off, and then we'll consolidate. I hope to consolidate that before we get back together as well too. But yes, yeah, we'll Parks and Rec heard exactly what you guys were all asking for as well too. We'll make sure that those questions are provided with answers, and we'll get them out to every one of you.
And also, if I may, real quick, we have 2 minutes. I know you will be out all of next week, so that even makes it more critical. So hopefully you get to play around with the spreadsheet, so that we can have we can play around with it when we come back on the 10th and get it ironed out, so that way we're not, back and forth. Yes.
All right.
Time up.
Okay. Any other questions?
Motion to adjourn, Mayor.
Motion, second. All in favor? Aye. Meeting adjourned.